This is the call to order for the Friday, March 20th, 2026 special meeting of the Finance and Government Operations Committee of the County of Santa Clara. Good afternoon, everyone. I'm so happy to see so many members of our community here and so many members of our network of care. Welcome to today's FGOC meeting. My name is Betty. I'm the chairperson of this committee, joined by Supervisor Ellenberg as my vice chair. Colin, I'm going to turn to you for a roll call to establish the presence of a quorum.
Vice Chairperson Ellenberg.
I'm here.
And Chairperson Young.
Here.
We have a quorum, thank you.
All right, we have a quorum. So before our hearing from county administration today and before hearing from our community leaders, I would like to make a brief opening statement, and then I'll invite my colleague, Vice Chair Ellenberg, to do the same. 6 months ago, in October of 2025, we held a special FGOC meeting to dive deep into the impacts that the federal and state actions would have on the county budget and our operations. Understanding the effect of the then recently passed H.R. 1 was a main focus of our work that day. We heard at length from the county administration about funding shortfalls associated with Medi-Cal enrollment and reimbursements, as well as related negative impacts to public hospitals and care for the indigent and uninsured. We also heard about enrollment impacts associated with food assistance programs such as CalFresh and how that would affect food security in our local community. As many of you know, just a few short weeks after that initial FGOC discussion, the community stepped up and passed Measure A. Many of you in this room today passed Measure A, a sales tax which is projected to raise about $330 million annually. And even with these new and important revenues, we still anticipate the need to cut hundreds of millions of dollars from the county's budget to ensure it is balanced in future fiscal years. Given this difficult reality, and with no hope for a change of heart at the federal level anytime soon, a logical next step is to reach out to our partners at the state who are also negatively impacted by federal actions. We are lucky to be represented by a delegation at the state level that understands there are opportunities for us to work together to mitigate some of the most dire impacts that H.R. 1 will have on Santa Clara County residents. To that end, we will be joined shortly by members of this delegation to both share with them our most pressing concerns about future operations, as well as ideas we have for how they might assist in reducing some of those impacts. We also look forward to hearing directly from them about their ideas for where they may be able to exert leadership to benefit Santa Clara County residents who will suffer under H.R. 1. And babies are welcome. They can make as much noise as they want in these chambers with these co-chairs right here. If baby wants to hop up here too, I'm more than open to doing some childcare duties. We also look forward to hearing directly from our state delegation about their ideas and how they will exert leadership, and our collective goal together to protect our most vulnerable from the impacts of H.R. 1. And also hear from them their insights, or from our state delegation, their insights into how the county can best advocate for its need at the state level. Simply put, today's meeting has two broad goals. One, to ensure the county and our state delegation are all rowing our shared lifeboat in the same direction. And two, because this conversation is taking place as part of a public meeting, to ensure the community is part of this conversation and has the opportunity to contribute to and shape the conversation as it moves forward. Specifically, we hope to leave today's meeting with a shared understanding of the areas of overlapping responsibility and interests that are of greatest concern, potential solutions, and how best to collaborate to bring that shared vision to reality. That is at the heart of why we felt it was so important to convene this special meeting, the Finance and Government Operations Committee. We need to work together in unison and with focus to ensure the most vulnerable amongst us aren't left to fend for themselves in the aftermath of reckless changes to federal policy. Each advance we make, no matter how small it may seem, will mean less suffering. Fewer in our community will go to bed hungry, and fewer will do without ready access to necessary medical care. We owe it to them to have these important but potentially difficult conversations. We will hear shortly from our county executive, and I don't think it will be a surprise to any of us in this room that the top three areas of concern include public hospital support, Medi-Cal and CalFresh enrollment, and health coverage for the uninsured and indigent. There is a very large list of items where the currently proposed state budget will negatively impact the county. Areas affecting everything from IHSS to trust, but everything hinges on the prior three for it to be able to survive and for our county to be able to thrive. So after we hear from the administration and community leaders representing key stakeholders in this conversation, we'll hear from 4 of our elected representatives from the state legislature. They are scheduled to join us at 3 p.m., and after their opening statements, the committee will engage with the state delegation in a discussion around shared goals and opportunities to collaborate and maximize our opportunities for successful outcomes. Following that discussion, we'll hear from public comment. And I just want to acknowledge that our state legislatures are going through their budget process right now, and for them to be able to make time to share that process with us today is a demonstration of their continued partnership with the county, our administration, and our community. At this time, I will turn to my colleague, Vice Chair Ellenberg, to hear from her opening comments.
Thank you so much, Supervisor Young, for convening today's special meeting. This county, as well as every other county across the state, is experiencing budget cuts of a scale and at a speed that no one anticipated. Medicaid, Medicare, supplemental nutrition funds, and other safety net services were created in the 1960s in an effort to alleviate deep poverty with the knowledge that we are all safer, healthier, and more stable when none of us is in desperate straits. Those programs have not only survived, but grown through both Democrat and Republican-led administrations and had seemingly become an intractable part of the fabric of our society. But then this decade has been full of unexpected world-shifting occurrences. Even months before H.R. 1 was signed and some reductions were expected, no one anticipated the size of the draconian dismantling of core health and safety net services. The ground truly shifted on July 4th, 2025. So here we sit in the chambers of the County Board of Supervisors. Counties are the entities that implement the safety net: healthcare, behavioral health, nutrition services, housing support, et cetera. But we have very limited control over the funding of these programs. They are all funded by state and federal government. Our current circumstances do not reflect a county-created crisis, and it is not a problem which counties should be expected to solve alone. And perhaps most importantly, this is not a one-year challenge. The cuts directed by H.R. 1 have created structural, ongoing impacts that will challenge the already fragile safety net for years to come. And if counties are forced to redirect limited general fund dollars to backfill these cuts, the consequences will be immediate. Programs on which residents rely, including public safety and prevention services, will be reduced or eliminated. We need the state's partnership to prevent that outcome. There are at least 3 areas where counties across the state are aligned with Santa Clara's leadership and where we need support. First, stabilizing public hospital systems. In this county alone, H.R. 1 creates a $1 billion annual deficit for our public health care system as the largest provider of Medi-Cal and Medicare services in the county and the largest public system in Northern California. We support the California Association of Public Hospitals' current request for a $500 million state investment to replace the non-federal share of Medicaid fee-for-service that public hospitals currently shoulder alone. But I also want to make clear that this is a conservative ask because it would only bring public hospitals to parity with privates and doesn't account for the fact that though public hospitals comprise only 6% of hospitals across the state, we provide more than 50% of trauma care. We'll also seek rate adjustments for public hospitals for trauma and burn services and additional asks in subsequent years. Second, investing in the workforce required to implement federal changes. Biannual redeterminations will double eligibility workloads at a time when counties are already struggling to hire and retain staff. Here, we support the County Welfare Directors Association's request for $373 million in the upcoming fiscal year to ensure Medi-Cal and CalFresh administration are adequately funded. An additional challenge that the state should be considering is the modernization of the data systems that are used by all county eligibility workers so they have the capacity to actually automate what will otherwise be incredibly time-consuming work to collect employer verification and other burdensome documents that are now required, to be clear, with the precise intention of making it more difficult to secure successful redetermination. Third, providing counties with a minimum of $2 billion annually to address the expected surge in uninsured residents. Millions of Californians who are currently eligible for Medicaid are projected to lose coverage due to new federal requirements and the expiration of covered California subsidies. The California State Association of Counties estimates county costs between $2 and $5.5 billion each year. Counties are doing everything within our control to manage significant levels of unreimbursed care, but without meaningful state partnership, the safety net on which Californians depend will erode and crumble. I want to thank in advance all of the state legislators who will be joining us today and those who are listening online. Thank you. We are counting on your partnership to take care of the residents who we jointly represent. Thank you for your leadership today and every day, and thank you for your attention.
Thank you, Vice Chair. Now we're going to, next item on the agenda, item number 3 is to consider changes to the committee agenda. Vice Chair Ellenberg, do you have any changes to propose?
I do not. I'm happy to move approval of the calendar as published.
Okay. And second that motion.
There we go. Okay. Vice Chairperson Ellenberg
Yes.
and Chairperson Young.
Yes.
Motion carries. Thank you.
Fantastic. We're now on to item 4, moving on to item 4 on the agenda, which is a study session relating to state budget impacts to the county, and it will start with a County of Santa Clara presentation. County Executive James Williams. James, I understand you will lead off the presentation for the administration with support from some of the key staff in the most heavily affected departments. The committee and members of the community with us in chambers today are looking forward to your presentation. When it concludes, we're hoping to have a clear idea of the areas where state budget and policy actions create an opportunity for collaboration that benefits our residents. Go ahead, James.
Thank you, Madam Chair, members of the committee. Good afternoon. James Williams, County Executive, and I'm pleased to be here with a number of our key staff, and I just want to extend a lot of appreciation for all of the stakeholders here in person and online. Our community cares. Our community recognizes and understands what's at stake. And sadly, I am in a position where I have to bring very sobering news about what is at stake for our safety net here in Santa Clara County, across the state of California, and the pivotal and essential partnership that we need from the state to do its piece to help ensure access to health care and food for all Californians. We are very fortunate to have an excellent delegation representing us at the state level, and I'll repeat that again later today, but they have been standing with us in this effort, and we will need them to carry these critical, essential asks forward as part of the upcoming legislative budget process. I'm going to take a few minutes to outline what we're talking about, what's at stake, and what the state can do to ensure that it does not exacerbate the harms foisted upon us by the federal government, but instead mitigates those harms. And sadly, the governor's January budget proposal, as it currently stands, exacerbates the harms. It does not move us in the right direction. And so we are seeking support from the state administration and the legislature to ensure the continuity of these critical, literally life-saving services for Californians. Let me share my screen. I have a brief PowerPoint to walk through. Great. So we're here because of H.R. 1, the so-called Big Beautiful Bill that was passed and signed into law by President Trump last July 4th. H.R. 1 imposes the largest cuts in our nation's history to Medicaid, which is Medi-Cal here in California, and federal food assistance known as CalFresh here in California, putting these critical programs at severe risk. Here in Santa Clara County, and you should know these numbers are even more staggering across the rest of California. 1 in 4 residents relies on Medi-Cal for access to health care, and 133,000 of our residents rely on CalFresh for access to food. And importantly, for our core services that we deliver as your county government, over half of our revenue as a health system depends on Medi-Cal. The threats to that funding are multifaceted in H.R. 1, meaning there's several different categories of cuts within that bill that layer over time that cumulatively represent an ongoing cut of over $1 billion. To make things worse, so far, what we've gotten from the state level exacerbates these impacts. And we'll talk about a couple of those pieces just now. One of the most significant is the state's own cuts to the state-only Medi-Cal program. More than 70,000 residents right here in Santa Clara County depend on this program for access to health care. The program is now frozen to new enrollees. We'll soon have monthly premiums, and we'll face a number of other significant impacts. There's also changes to funding mechanisms that affect our community clinics and our own clinics that are an essential part of the delivery of primary care here in the community. They could see a 70 to 80% drop in reimbursement for these essential services. The governor's proposal doesn't address these harms, doesn't address the H.R. 1 harms. We're very supportive of Senator Durazo's SB 1422, which is a bill that would seek to reverse some of the damage caused by state-only Medi-Cal cuts. But wanted to call that out as one of the very specific and concrete ways in which the state is right now making things worse. So I talked about the layering of these cuts over the next couple of years. We've shared this before, but it shows how even in this current fiscal year 25-26 that we're now more than halfway through, we've already been hit with immediate budgetary impacts associated with H.R. 1. That number grows in the upcoming fiscal year and the fiscal year thereafter. These are ongoing reductions to revenue, not one time. They require ongoing solutions because unlike the federal government, we have no choice but to maintain a balanced budget. We don't get to print money. And so we are in the very difficult position of having to deal with these immediately as they affect us. In addition to what we're seeing just on the healthcare side with Medi-Cal, we also need to be aware of other state-related changes that unfortunately from a timing perspective are hitting us at the exact same time. And that is a series of changes at the state level to behavioral health funding and programs that both change how much money counties get, what percentage share counties get, but also how counties are obligated to spend this funding, which will have a disproportionate and severe impact on our behavioral health department and also the incredible network of community providers who deliver those essential services, and will force shifts in service delivery away from certain categories like prevention towards other categories. These are state-directed policy changes that have been foisted on us on top of what we're seeing in federal cuts. So what are we doing? Well, this community doesn't take things lying down. We have committed and have pushed back with every lever, and we have pushed every button we possibly can. Internally, as a county organization, we put in place a very aggressive hiring freeze. We have already moved forward with significant and painful budget cuts, including $200 million in budget solutions that the board adopted mid-year this year to keep our budget in balance, largely involving our health system. We have moved forward with a litany of initiatives to increase revenues, reorganize services, to try to mitigate impacts on the most vulnerable to the greatest extent possible. We're not in Sacramento, where I was testifying yesterday seeking a handout. We're in Sacramento because it is an essential and fundamental partnership in the delivery of these services. And we are not standing still as a county organization, but instead have been moving forward every initiative that we can. And of course, our community has stepped up as well, with the leadership of our Board of Supervisors in placing an emergency measure on the ballot. Our voters here overwhelmingly stepped forward, adopted a sales tax increase at the highest amount we are able to bring forward to them under state law. And yet, as incredible as Measure A is, and it is, and as much as it will mitigate and soften impacts that we otherwise will face, $330 million, unfortunately, does not a billion make. And so we have a daunting gap to continue to address. But we have moved forward with our prongs of our approach in a strategic, aggressive, and thoughtful way. And we will continue to do our piece, but today's conversation is about state partnership, because we need the state to do its piece as well. And what does that look like? We have put forward a series of concrete and specific steps that we believe it is essential for the state to take to preserve these critical services here in Santa Clara County and across California. The first piece is support for public hospital systems. There are not that many counties that still have public hospital systems, but the counties that do are where about 80% of the population of California lives, and these 6% of California's hospitals, 6%, operate half of the state's trauma and burn centers and train over half of the state's physicians. Think about that, 6% of hospitals. And so the health care for all Californians is built on the backbone of this public health care delivery system that the state cannot afford to lose. At a bare minimum, it is essential for the legislature to undo something that happened in 2005, which was a state change that forced counties to fund the state's match to draw down federal Medicaid dollars for inpatient hospital stays. This is an area where we are treated worse than private hospitals, and we are seeking just parity with those private systems so that we can free up that local funding to help preserve the public hospital systems. In addition to that, it is essential for the state to make appropriate base rate adjustments to make up for the loss in specific revenue streams that public hospitals rely on for the delivery of essential care. Second, we have to keep as many people as possible enrolled in Medi-Cal. What does that mean? Well, it does mean doing everything the state can to make sure that there is as much automatic verification of eligibility as possible. As Supervisor Ellenberg shared, though, the federal government is deliberately trying to throw people off of coverage. And so that is going to be a very challenging task as it would be even in the best case scenario. And so we're also going to need more hand-holding on the ground to help people jump through these hoops that are being deliberately created so people lose coverage. And we are urging the legislature in coalition with the California Welfare Directors Association, which is the consortium of social services directors from all of 58 counties in California, to support a modest investment in resources to help ensure that we are positioned to, as much as possible, hold people's hands through that process. For every person we can keep on coverage, because we're talking primarily about the expansion population, for every person we can keep on coverage, the federal government covers 90% of the cost. So it absolutely behooves the state to do everything possible to support all 58 counties in this endeavor. The third piece is to deal with the reality that more people will be uninsured. After the passage of the Affordable Care Act, the state revisited its fiscal relationship with counties for coverage of indigent care programs. And counties lost state funding for these services. Unfortunately, with an increase in uninsured, the state must revisit that fiscal arrangement. There's no way around that. And restore funding to counties to ensure that we can provide access to health care for those who lose coverage. And finally, for the state not to exacerbate these harms by making its own cuts in the state-only program, and instead to preserve full access to that program so that all Californians can continue to receive access to life-saving health care. There's two other pieces I wanted to note that are relevant to the state budget conversation. One is that there's a very problematic proposal in the governor's budget to shift to counties more costs related to the IHSS program and to eliminate state funding for mobile crisis response. These are essential programs for the state to not back away from its funding commitments. Shifting these costs to counties will only put counties in a worse position for both these services and others. And relatedly, to restore funding for the HAP program and ensure that it's a stable source of funding to deal with the very real and present needs for homeless housing assistance, especially in the context of significant federal challenges there as well. So it's a sobering update. We have brought forward a package of comprehensive proposed solutions. We recognize that the state is in a challenging fiscal situation as well, although not nearly as challenging proportionately as that faced by counties. But what we do know is that California cannot look the other way and cannot wait to see what happens, because once these types of services go away, you lose a multi-generational commitment and investment in access to care that we cannot afford to let happen as a state. So we look forward to the leadership of our delegation in this effort. We will continue to lead as a county organization with creativity, with strength, with a deep commitment to values, to doing everything that we can, but knowing that we cannot do it alone. Happy to take any questions that you might have now or later. Thank you.
Thank you, James. Thank you for that very sobering presentation. And as always, for always getting right to the heart of the matter. We're going to continue with the presentations and then have discussion towards the end. I also just want to welcome and announce that we have Senators Dave Cortese and Aisha Wahab with us. Their images will be projected momentarily as they receive today's presentations as well. So at this time, we're going to move into item number 4B, is community statements. We are joined by representatives from Community Health Partnership, Ability Path, Valley Health Foundation, the Silicon Valley Council of Nonprofits, Behavioral Health Community Association, Working Partnerships USA, and South Bay Labor Council. I'm sorry, Behavioral Health Contractors Association. We're going to start, we're going to move from my right to left, starting with Dolores Alvarado from Community Health Partnership and finishing with Jean Cohen of the South Bay Labor Council. Before speaking, please state your name, your organization. No need to wait on me for the prompt to the next speaker. The floor is yours, and I turn to you, Dolores, to kick us off.
It's not.
The mic is not on. There's a, Colin will come help.
Oh, thank you very much. Thank you. Good afternoon, everyone. Good afternoon, Supervisors Ellenberg and Young and James Williams, et cetera. Thank you for inviting us to be here and share in this sober moment, I guess is the best way to say that. I really want to talk about, have a little conversation, I guess, about what the situation looks like for us, the community health centers, and how happy we are to be here today with you in partnership. So the community health centers in 2025 served about 200,000 folks. That was before the whole ICE situation. Out of those, 21,000 took advantage of the specialty care services that Valley Medical Center provides. And this has been going on for many years, by the way, the 20 to 21,000. So that's the reason, for many reasons as well, but particularly because of our relationship to VMC and the partnership we have with them in the specialty care arena. I am here representing the community health centers and the board of directors, and two or three of the board members are here. I think it's two. We endorse Santa Clara's request for partnership. We not only do we endorse it, we are going to participate in this. We started out by looking at the UIS data that we have, and many thanks to James and to Brian Darrow and Valley Health Plan for getting us the data. We got it this morning, and it's worse than we thought, unfortunately. The impacts to HR1 on indigent, uninsured, and UAS patients is catastrophic, as we know. I see it as inhumane, and honestly, it goes against federal legislation that HRSA had put together back in the 80s under Ted Kennedy, and that included the 330 grants, which have been coming to us for many years, and to the clinics. It's one of the benefits of being a federally qualified health center. That money was often utilized to help those that did not have coverage and that they had no other option. So that is, I know you brought it up, James, I believe, in your presentation. That's a very, very serious concern. Along with that comes the concern of the reimbursement model that the community health centers, federally qualified health centers, which again includes the county because they also have federally qualified health centers, and that methodology, which is sort of a combination of a state and federal, but mostly state, is set to sunset at some point in the near future. So when you add the 330 grant removal plus the PPS, it's called the Patient Prospective Payment System, I believe. I want to just, I know that those that are in the audience, I think, were our partners and friends and family. I'd like to make a statement about the fact that VMC, Regional, St. Louis, et cetera, have been serving many, many people who perhaps have other form of health coverage or perhaps have needs, are well off economically. So the issue of comments that I've heard, this is only for the uninsured, this is only for Medi-Cal, this isn't true, and I can verify that. I can verify it with my own family, by the way. So what we're asking for, and good afternoon, Assemblyman Clara, thank you for being here. We're asking for a couple of things that are huge. One is to ensure that the CalSOS program remains. CalSOS is a data system that has truly helped us enroll folks, timely renew their applications, and keep track of where they are with their Medi-Cal. With the fact that there's now going to be a biannual enrollment system. If CalSOS goes away, we go back to pen and pencil. So that is really, really important to us. It is not as well known that piece is in danger. Like the county, our community health centers must serve everyone, regardless of health coverage or ability to pay. We anticipate the demand for care at our health centers will only increase due to the reductions that we talked about and the PPS system, the loss of the PPS system. I want to just share with you a couple of examples of the additional services that the community health centers provide besides primary care. Child development services, chiropractic, community outreach, dental health, enrollments, healthcare enrollments, housing referrals, specialty mental health, which I think will be discussed later, wellness and prevention, which is often not reimbursed by anyone, so we often use the 330 grant to do that, and nutrition counseling, which is often not reimbursed by anything. So that, in addition to primary care, is really important to us. Not only do we lose the primary care piece, we lose the other services that address the social determinants of health. We're a county that are always talking about social determinants of health. We are a state that is always talking about that. So this is really important to us. The last comment I'd like to make, because we do have some clinics that will speak, I have some data that I'd like to share with our state assemblyman, and you're not going to like the data. You give me 1 second. The California Primary Care Association helped us pull this data together for today. In Assembly District 25, Assemblyman Clara, California Primary Care Association estimates that your district has approximately 41,000, almost 42,000 UIS population, half of them being served by community health centers, which equates to a loss of $14 million to start with in revenue in 1 year. Assemblyman District 26, Mr. Patrick Aarons, thank you for being here, estimates that the district has about 22,000, a little bit over 22,000 UIS, with over half of them being served by community health centers, and that equates to 7.5 million. Now, before I move forward, the other half, we know half of the data, the other half are probably private community clinics. So those may or may not be part of the CPA. So you can possibly double the amount, in my opinion. For Senatorial District 15, Senator Cortese, good afternoon. We estimate that the district has a UIS population of a little over, almost 34,000. That equates a loss of $22.6 million. These conservative numbers only reflect losses by CPCA member health centers. Individual health centers who are not members of CPCA are not in this data. At this point, we have enough to ask you the following. We respectfully ask that you do whatever you can to enact state funding measures to protect all of the residents, especially the indigent, the uninsured, and the UIS population. My team is here, my family is here. This is a family affair, and I just want to thank you and finish by stating that Community Health Center's priorities are in total alignment with the county's priorities and hopefully with the state priorities. Thank you.
Hi, my name is Brian Nider. I'm CEO of Ability Path. I want to tell you about a family. Marla is 34. She has a developmental disability. She lives with her aging parents in San Jose. Her father works in construction. Her mother provides for Marla's care. Marla receives Medi-Cal, which covers her supported living services, behavioral health support, and monthly visits to Santa Clara Valley Healthcare. She participates in a day program. She has friends. She has dignity. She has a life. Under H.R. 1, her life would begin to unravel. Under H.R. 1, work reporting requirements designed for people without disabilities, administered by an already overwhelmed social services workforce, puts Marla's Medi-Cal eligibility at risk. One missed form, one missed system error, one eligibility worker stretched too thin, and Marla loses her health care. Her services stop. Her parents, both in their 60s, become her only support system overnight. This isn't hypothetical. Nearly 3 million Californians, including individuals and their family members, live with developmental disabilities. They are among the most Medi-Cal dependent, vulnerable, and invisible population in every conversation happening in Sacramento and in Washington, D.C. right now. I'm CEO again of Ability Path. We serve nearly 1,500 individuals with developmental disabilities for over 100 years. I stand with Santa Clara County and urgently asking the state to take action. The county's documents presented today outline a $1 billion annual deficit to our public health system, the largest in Northern California. For the IDD community, this isn't just an abstract figure. Santa Clara Valley Healthcare is where Marla goes when she has a seizure at 2 a.m. It's the only system equipped to treat her. We are urging the legislature to take 3 actions. Maintain Medi-Cal enrollment by investing in the eligibility systems that safeguard individuals like Marla. Provide dedicated funding for public hospitals and the healthcare system that serves our community, often disproportionately, and supply the necessary resources to counties to handle the surge of uninsured people when subsidies end. Marla's parents lie awake at night wondering, who will care for our daughter when we're gone? The state of California has the power, and I would add the moral obligation to answer that question for our friends, our neighbors, and our family members, but only if it acts now. I want to thank the Santa Clara County Supervisors for providing this opportunity to share our concern and the impact it has to people that we live with, we know, and care for across the entire state. Thank you.
Good afternoon. I'm Elisa Koff-Ginsburg with the Behavioral Health Community Association, honored to represent the nonprofit agencies that form our county's behavioral health safety net. Our county has a long-standing tradition established by Senator Cortese and previous board members and continued by Supervisors Young and Ellenberg of recognizing the critical importance of supporting those living with mental illness and addiction. We have gone beyond minimum requirements to build a system that truly serves our most vulnerable residents. Today, that commitment is at risk due to significant federal and state budget pressures. Without fulfillment of the budget requests outlined by our county executive, we face the very real and frightening prospect of scaling back services to only the most emergent needs. On behalf of children who have been traumatized, those struggling with addiction, adults whose days are challenged by their severe mental illness, and their impacted families, as well as those in the community who serve them, I want to urge our state delegation not only to support these requests, but to make them your top priority, just as our county and community have done in the passage of Measure A. Even with these resources, difficult decisions remain. These requests represent the minimum needed to sustain our system. In addition to the devastating impact of the loss of Medi-Cal coverage that many will speak to, behavioral health faces the largest proportional deficit due to multiple converging factors. Prop 1 expands investment in intensive services but reduces flexibility, shifting resources away from foundational services that prevent escalation. These are the services that keep individuals from reaching crisis. It also shifts responsibility for prevention among children and youth without assurance that schools are prepared to meet that need and without assurance that redirected state funding will come to our county. I also want to highlight the governor's proposal to make mobile crisis an optional benefit, shifting those costs to counties. This loss of funding may push mental health and substance use crisis response back onto law enforcement, leading to poorer outcomes, higher costs, unnecessary incarcerations, and hospitalization. Finally, the state must act quickly to correct errors in specialty mental health fee schedule rates. In our county, crisis residential and adult residential treatment rates have been incorrectly swapped for 3 years, resulting in substantial losses. We have more crisis residential beds, yet they are reimbursed at a lower rate than less intensive care. I thank you all for the opportunity to speak to you today. My colleagues who do the very hard work of supporting the vulnerable residents of our community will share more real-world impacts during public comment. Thank you.
Good afternoon, everyone. I'm Michael Elliott, Executive Director of Valley Health Foundation. Supervisor Young, Supervisor Ellenberg, thank you for having us here today. Assemblyman Clara, Assemblyman Ahrens, Senator Cortese, thank you so much for taking time out of your busy schedule to hear our testimony. I want to thank you, in particular our partners at the State Assembly and State Senate, for your leadership. I know all of you care about this issue and are willing to fight for us. I am hoping that you take the message today to your colleagues who may not fully appreciate the gravity of what we are facing. Because as we all know, H.R. 1 is not a routine policy change. It is the equivalent to an earthquake, a wildfire, a drought combined into a single event, except it doesn't pass. It repeats day after day in the form of reduced access, growing need, and mounting pressure on the systems that people rely on. As you know, in this county alone, our public health care system is facing a $1 billion annual impact. And that's not abstract. It means fewer services, longer wait times, and harder decisions about who gets care and when. But we have not stood still. Our Board of Supervisors has already acted, approving $200 million in reductions this year with more to come. Santa Clara Valley Healthcare has looked for efficiencies and new revenue where possible. And most importantly, our residents have stepped up. Last fall, as we all know, voters passed Measure A to preserve essential services to protect our public hospitals. That was not easy. It required trust, urgency, and a willingness from this community to tax itself to protect its most vulnerable. So let me be clear, in Santa Clara County, we are not waiting. We are organized, we are engaged, and we are ready to fight to make sure that all of our residents can have access to the healthcare services that they need. But there is only so much that we can do at a local level. And that's why state partnership isn't just helpful, it is essential. We strongly support the county's recommendations before you today and ask the state to act in a very few specific ways. 1, invest in our public hospital systems. 2, protect and fund the workforce that administers Medi-Cal and CalFresh. 3, recognize the coming wave of the uninsured and that every strategy and resource must be deployed to keep as many people covered as possible. And last but not least, avoid cost shifts that simply put additional burdens on counties for the programs we do not control. Let me close with this. As I alluded to before, this is like a natural disaster, but it is a man-made disaster. A man-made disaster. The decisions that created this were made in Washington, but the consequences will be felt here, in our clinics, our emergency rooms, and in our communities. Santa Clara County has stepped up. Our residents have stepped up. We have stretched every local tool we have and then some, but we are reaching the edge of what local communities and local government can carry. Without state leadership, our safety net will fray, access will shrink, and people will fall through, not because we fail to act, but because we are left without the means to keep going. We need the state to act with urgency and at scale before those consequences become irreversible. Thank you.
Nice. Good afternoon, Chair Young, Vice Chair Ellenberg, and partners at the county and state. Thank you for the opportunity to speak today. My name is Kylie Clark, and I am here on behalf of the Silicon Valley Council of Nonprofits. First, I want to express SVN's strong support for the county's request to the state, providing dedicated ongoing funding for public hospital systems, preserving enrollment in Medi-Cal and CalFresh through investments in eligibility systems, allocating funding for uninsured care, and reversing harmful cuts to the state-only Medi-Cal program are all critical steps to protect the health and stability of our communities. These are thoughtful, targeted solutions that recognize both the scale and the urgency of the challenge in front of us. I also want to share what we are hearing directly from the nonprofit sector. This week, SVCN and Thrive Alliance released our Nonprofit Pulse report, which captures how federal instability is already affecting organizations on the ground. These findings are completely stark. 78% of nonprofits report increased demand for services. More than 40% say their financial health has worsened compared to last year. Nearly 40% have already experienced challenges receiving promised federal funding, and 73% report spending significant staff time responding to federal policy changes. At the same time, most organizations report that philanthropic funding is not replacing lost federal dollars. Deep cuts to county programs risk triggering downstream impacts that strain our safety net services and nonprofit providers, undermining the stability of nonprofit organizations and of the entire system. What all of this tells us is that nonprofits are continuing to show up for our communities, but they are doing so under growing strain and with fewer resources. The report also identifies opportunities for action. They need faster and simpler government funding processes so that they can focus on service delivery instead of administrative burden. They are asking to be meaningfully included in policy decisions that affect their work in the communities they serve. And they're calling for stronger protections for vulnerable populations and long-term support for nonprofit infrastructure and for community power building. We look forward to working with the county leadership to explore how these recommendations can be implemented at the local level and how we can align our efforts to respond to this crisis together. I also want to express our gratitude to District 4 for the county inventory funding that supported SVCN in partnering with the county to host 2 budget town halls, one for nonprofits and one for the broader community. Through these conversations, the county and our organization were able to gather feedback directly from the organizations and individuals who will be most impacted by these cuts. We look forward to sharing our findings as we work through this challenge together. I want to close with this. We are in an emergency. The County of Santa Clara cannot solve it alone. The nonprofit sector cannot solve it alone. And the state cannot solve it alone. It will be solved by working together with commitment, dedication, collaboration, and a shared belief that we have to stand up for our communities and stand together. Thank you.
Good afternoon. My name is Maria Noel Fernandez, and I'm the Executive Director of Working Partnerships USA. And first, let me just also express my gratitude to our supervisors, Young and Ellenberg, our assembly members, and of course also our senators, Cortese and Wahab. At Working Partnerships USA, we are in community every day with patients and workers who rely on the Santa Clara County Public Health System for critical care, for themselves and their families. What we know is this: far too many in our community have almost nowhere to turn. They rely on the county's safety net and public hospital system for basic healthcare needs and for life-saving care. In Santa Clara County, part of the reason why I'm so proud to do this work here is that we've always believed that healthcare is a right, not a privilege, and we have stepped up at every turn. When HCA, a corporation, began cutting services from Regional Medical Center on the east side, we collectively, so many people in this room, collectively stepped in and saved that hospital. And when H.R. 1 threatened to gut our county budget, we came together and passed Measure A, which all of us here have mentioned already because we are so proud of the work that we've done together. But with H.R. 1, the federal administration made a different choice. And we have to just be clear with each other. They're cutting care to fund tax breaks for billionaires. That is not who we are in Santa Clara County, and that is not who we are in California. Measure A was a signal from residents and the community that we will not abandon its most vulnerable. Now we're calling on the state to stand with us and to make the same choice we've already made in this county. Santa Clara County runs the second largest public health system in California, and Santa Clara County has about 400,000 people that depend on Medi-Cal. But what makes our county uniquely vulnerable is this. A majority of our Medi-Cal and Medicare patients rely on the public hospital and clinic system for their care. And H.R. 1 targets the public hospital systems and their patients in ways that leave counties like ours disproportionately exposed. That's why we are here today. Community, clinics, advocates, labor, philanthropy, asking Sacramento to recognize that distinction and continue to step up and step in with us and share in this responsibility. Across Santa Clara County, we are united in saying this. This is the priority. If people cannot access health care, everything else we work together on, everything we work towards around stable jobs, affordable housing, and thriving families becomes impossible to achieve. So you've heard our asks, you've heard the needs that we have. As our state representatives, we're counting on you to carry our voices and our values into the Capitol, as you all do so well already on a daily basis, and we are grateful for your leadership and look forward to continuing to work together. Thank you.
Good afternoon. My name is Jean Cohen. I'm the Executive Officer of the South Bay Labor Council. We represent over 100,000 working families in the South Bay, union members, many of whom are in the audience today, to one, thank you for all of the hard work that you have done to ensure that Santa Clara County remains a safe place, but also to urge you to continue to be our partners in the important work ahead of us. We know that the federal government made a choice to prioritize billionaires and the wealthiest instead of investing in working people. And now the consequences of that choice are being pushed down onto states, counties, and the community. What we are seeing on the ground is real, a $1 billion annual impact to our public health care system, growing numbers of uninsured, poverty wages, increased demands for food and housing and behavioral health services, and a mounting pressure on the public workforce, our county employees, who both deliver these services and rely on them to support their own families. The threats to our safety net are not isolated, they are systemic, and they are hitting at every level and all at once. So this moment requires more than cuts and more than delays and more than short-term fixes. It requires revenue, policy leadership, and new ideas that match the scale of the challenge and compounding pressures. This is a moment to think differently about how we finance care, how we deliver services, and how we partner across the state and local governments to close gaps before they become crises. The reality is this: we need our leaders and our allies in Sacramento to follow our local delegation, to flex their influence, to find solutions, and to use their values as the foundation for all of that. If the federal government is stepping back, we are going to continue to step up, and we're going to do that in partnership with our workers. Right now, county departments are being asked to manage increased caseloads, more frequent eligibility determinations, and higher service demand without corresponding resources. And county employees are both delivering these services and in many cases relying on them. This dual impact is important. When the safety net is weakened, it affects both the people being served and the workforce responsible for delivering those services. Given this context, we urge Sacramento to focus on these three things. One, revenue stability. The state will need ongoing sustainable revenue solutions to maintain core services. Second, policy alignment. We strongly urge the legislature to reject cost-shifting proposals, including those related to IHSS. These shifts do not reduce costs, and our focus should be on including and providing home care workers with the wages and benefits that they deserve. Third, targeted investments in system capacity. Ongoing funding for public hospitals, investments in the workforce delivering these services, and continued and expanded funding for our most vulnerable. We also encourage the state to consider new approaches to financing and delivering care, particularly as the uninsured population is expected to grow. This is a structural shift in how we deliver our safety net services, how they're funded nationally and by the state, and we need to respond urgently and correspondingly. And finally, we just want to emphasize that we know this is a shared responsibility. Counties cannot absorb these impacts alone. Workers cannot absorb these impacts alone. But addressing this moment will require coordinated action between the state, our counties, labor, and community groups. And we're committed to being part of that work and urge the legislature to follow our own local delegation and to continue working in partnership to protect core services and the workers who sustain them. Thank you.
Thank you so much for the powerful statements today. I think sobering is the theme of the day, and we've heard you loud and clear, and we will continue these conversations. It's very clear that no one is escaping the impacts of HR 1 unscathed, and that also means that no one will be shouldering it alone. We're going to do this together. And now we're going to turn to item 4C, which is our state delegation. I had these very beautiful introductions prepared for our Assembly members Clara, Aaron, Senator Cortese, Senator Wahab. We're going to skip that today. Just know that we love you and we're amongst friends. But I'm going to, in the interest of time, but I'm going to say thank you for being our champions at the state level, for continuing to represent the county, your Bay Area. I know it's a huge fight up there. You're not going to ease up, neither are we, and today we lean into how we continue to partner together. So first up, we're going to hear from former Supervisor and current Senator Cortese, followed by Senator Wahab, and then Assemblymember Clara, and closing us out will be Assemblymember Patrick Aaron.
I thought we were going in alphabetical order.
And then we're going to engage in a discussion and create a path forward. Does that sound good to everybody? Let's do this. Senator Cortese, you are up.
We can't hear you, Senator. They're working on it on this end as well. We'll let you know as soon as we can hear you.
Senator Cortese, if you can give me a thumbs up, we're going to turn to Assemblymember Clara while we work on the sound. Is that okay with you? Signal a thumbs up. All right. Assemblymember Clara. Alphabetical order.
Thank you so much. Good afternoon, everyone. Honored to be here with my colleagues, both virtually and my colleague to my left, Senator Aarons. I represent this District 25, which covers much of San Jose, including downtown and large open spaces in southeast Santa Clara County. And I want to thank Supervisor Young for convening this important conversation, and to the county, including Supervisor Ellenberg and the county management, for your continued leadership during an incredibly challenging time. And I've said this many times before when I'm in Sacramento, this county is very well regarded for the creative ways in which it serves the community, the investment it makes in our community. And I think that's not only a reflection of our elected leadership and county management, but a reflection of so many that are here in the audience, the community that demands services that they deserve, and today is no exception. And we do need to be clear about what's happening right now. The federal government's big ugly bill is driving a manufacturer crisis here at the local level. If it weren't for federal impacts, both from that bill as well as military actions that are draining our resources and creating economic uncertainty, we would actually quite likely be looking at a surplus this year in the state budget. But because of the impacts that have already occurred from the federal budget and ones we know are coming around the corner, on top of the dire economic uncertainty, not just in terms of fuel costs, but really our economy as a whole, has put us in a very difficult position, all of us, from Sacramento to Santa Clara County. And as others have already pointed out, that H.R. 1 from the federal government translates to roughly a $1 billion annual shortfall, threatening core services our communities rely on. And this has a real tangible impact on people's lives, healthcare access, food assistance, behavioral health services, and support for those who need it most. And as usual, the burden falls hardest on working families, seniors, people with disabilities, and immigrant communities. Now, the county has already taken strong steps, making difficult budget decisions, as we heard, the cuts that have already been made, and asking voters to step up through Measure A, which I was proud to support, and I'm very proud of our community during challenging economic times, understanding the need for us to pass Measure A. But even with those efforts, local government cannot absorb a crisis of this scale alone. And that's why the partnership with the state is so critical right now. I want to thank Senator Cortese, who well over a year now has been convening members in Sacramento, oftentimes inviting county management and some of our public policy folks to speak directly to legislators, to hear about the impacts, the devastating impacts that some of the, not just federal cuts, but potential and state cuts, or even state cuts that have already happened, the devastating impacts it has at the local level. And I want to thank Assemblymember Ahrens. I was proud to join him and our local delegation in supporting the county's budget requests to protect and stabilize our safety net, including Medi-Cal, CalFresh, our public hospital system, and critical services like IHSS and mobile crisis response teams. Also, is part of a cohort of ours we call the Legislative Progressive Caucus. We are pushing back on any efforts to further make cuts, and in fact want to restore cuts that were made to ensure that all of our undocumented brothers and sisters receive the same access to health care as their neighbors. We also, and I know we may touch on this going forward, are supportive of revenue generation opportunities and look forward to discussing that as well. I'm committed to continue to fight for our communities up in Sacramento, not just to defend what we have, but to push for real transformative change. That includes the reintroduction of CalCare, which I reintroduced a few weeks ago, AB 1900, to guarantee health care for all, and continuing our work to protect seniors and strengthen long-term care systems here in California. Thank you for having me this afternoon.
Thank you so much, Assemblymember Clara. I'm going to see if Senator Cortese, can we do a sound check?
Yes.
Oh, here we go. All right. Welcome, Senator Cortese.
Thank you very much. I'm not sure what the issue was before. It gave me the clear unmute sign on the iPad, but it didn't work. I'm happy to be with you. I was trying to say a few minutes ago, thank you so much to our two county supervisors who are the FGOC committee members here. Having served on that committee during the time I was on the Board of Supervisors, I know how critical your work is in terms of vetting issues, not just today, but constantly throughout the year, and how important that is to the overall Board of Supervisors and to county administration. So even more so, thank you for inviting us to participate. Supervisor Young, Supervisor Ellenberg, I appreciate the opportunity. I know I just have a few minutes to make some opening comments, and you've given us a lot, none of which we are not aware of, all of which we are aware of, actually. I want to thank some Clara for acknowledging the work we've been doing going all the way back approximately a year ago, perhaps a little less than a year ago, bringing people together in informal groups and caucuses, and existing caucuses and informal caucuses, bringing in folks like County Executive James Williams and others to make sure many of the issues and the potential impacts of HR 1 were and are understood by as many people as possible in the legislative delegation. I think that awareness is pretty significant at this point. And let me just try to respond to a few things. First of all, I want to say something that's a little bit, has a little bit to do with the difference in governments in the position I'm in now versus the position I was in as a county supervisor. We don't have a lot of people coming into the state capitol through our policy committee process and our budget hearing process like you have in the room today. That's a problem. As long as our issues are framed as the state is going to hurt the county, or the county is going to get hurt by the state, a lot of people hear that, I believe, as governments competing for dollars in order to try to balance their own budgets, in order to do their own governance, their own work. And it is, it's true. But the real fact here is that we absolutely have overlapping, identical common constituencies. If you add up the 40 Senate districts and the 80 Assembly districts, it comprises the exact same population as the 58 counties. So the folks that you are reminding us that are going to get hurt by one action or another are the same folks that that vote for us or not, the same folks that we owe those same responsibilities to. And anything you can do with your really greater ability to to drum up grassroots support, to get letters into the portals. People don't have to go to Sacramento anymore. There's a tremendous amount of activity that comes into every analysis on every bill, including the budget bills. That's just basically the same kind of testimony we've heard today, but it should be coming in droves. It should be coming, as far as I'm concerned, every legislator should be looking at every committee analysis this year and seeing constituents from his or her own district making these same asks that you're making today. Because everybody in Sacramento, I don't want to be crass, understands that they're elected or not based on what their constituents think of them. Honestly, not what county administration thinks of them. So that's just a basic political natural law that I wanted to get out there and kind of remind everyone of. We hear a lot from your lobbyists. They're good, and I'm sure they're listening today. Every county has those. Los Angeles has many of those, but it's important for us to hear from actual residents, whether documented or undocumented, rich or poor, whatever their situation is. Anything you can do to help with that is great. Our process is that the governor puts out a base budget in January that, frankly, is oftentimes a piece of gamesmanship work or bargaining work. For example, aside from direct county issues, there's an almost $6 billion proposal by the governor to rebench or to grab and utilize Prop 98 money, education money for the general fund. That's not typically something that's going to fly, but it's put in the base budget in January as forcing the Assembly and the Senate in our individual budget proposals. And yes, the Senate and the Assembly have separate processes and separate proposals to bring forward our versions of the budget, it forces us then to ask that that money gets put back. And any of you who've been at any kind of a bargaining table understand what that means. Now, all of a sudden, we are asking for something to be put back in the budget that should have never been cut in the first place or should have never been proposed in the first place. It's not this governor, that's just the way that process works. So you're right to identify things like the uninsured Medi-Cal cuts. We call it the state-funded piece of Medi-Cal that's already taken hits and that would be proposed to take more hits in the current budget. That shouldn't happen. We are then forced, when the governor does that, to ask for that money back, which obviously opens the door for him to ask for something from us as well, maybe something he likes a little more than we do. So that process is ongoing right now. May 15th, as you know, the revise will come out. It will reflect, I believe, some progress in the Assembly and Senate caused by the Assembly and Senate in terms of getting some of what you're seeing in the January base budget straightened out, kind of rectified, but not all. And then there's a sprint from May 15th to June 15th to keep negotiating Senate, Assembly, and Governor on whatever else we can bring leverage to in that conversation. Everything that you've asked for, this group, as you've alluded to, this group of senators and assembly members have pushed very, very hard for ever since that budget came out, ever since that base budget proposal came out. So the answer, I think, to each and every one of your requests truly is, we're already doing it. I can't speak to the Assembly's internal process, and I'm only at liberty to describe the Senate process in general terms. But I will tell you that we started surveying each and every senator in our caucus, Democratic caucus, which, as you know, is a supermajority of the Senate. We started surveying over 90 different budget items through a very professional survey process, much like if you were polling a group yourself. And we've done that repeatedly. And then we've taken and debated the results of the surveys in person, at times all day long. And I will tell you that there's not any natural appetite for any of the things that feel like piling on to you, especially in the Health and Human Services area. Like the county, we can't print money. We started off with what was supposed to be a $14 billion deficit, with a $30 billion structural deficit on top of that as a minimum over the next 3 years. We've done nothing to address the structural deficit. The governor, at this point, as you know, is calling the January budget a balanced budget, despite the fact that it's built on these draconian state-funded Medi-Cal cuts, as well as things like I mentioned in terms of education funding. So I can tell you, I can't tell you the results of Senator Wahab exactly, although I know her sentiments, but I can't tell you what Senator Razzo from Los Angeles is saying about these cuts or these proposals, or Senator Gonzalez or Senator Blakespear or any of the other 40 members of the Senate. But I can tell you generally, there's no appetite for these cuts, and there is an appetite for new revenue measures. And the appetite for new revenue measures thus far, which is no secret, has revolved around closing the so-called Water's Edge loophole, which would raise a few $1 billion, maybe $3 billion annually, but it should be done, in my opinion. And a Medi-Cal backfill that's targeted at large employers who have been essentially Medi-Cal and healthcare benefit scofflaws. Big retailers, you know who they are, and others who basically provide no health care benefits and push their employees, onto our Medicaid rolls, insured or uninsured. That's not okay. And with a 2/3 vote of both houses, we could correct that now. We don't have to wait. There's a lot of appetite for that. Is there a 2/3 vote? I don't know. We'll see. But proposals have been made. When you combine those two things, you pick up as much as $12 billion a year. And the Medicaid funding, because it's Medicaid funding, bypasses Prop 98. So 100% of that is money that would benefit not only the state Medicaid system, but by trickling down the counties as well. So we're doing everything we can to sort of be the opposite of people who are piling on and exacerbating problems and making them worse. I haven't seen a budget process start this early before with elected officials in all of my years, school board, city, county. I've never seen the rigor that at least our caucus in the Senate has employed as early as it has. The first week of February, we were as deeply into these issues as we are today in this hearing. I say that not to defend our actions, but so that you have hope, so that you realize we're on it, we're working on it, and it's not just your Santa Clara County delegation. There are many, many people who we consider to be allies at this work. Just look at Assemblymember Aaron's $500 million ask, his letter, and how he was able to pick up many co-signatures on that. That's indicative of how many people in the legislature feel about where we need to go. Where we end up is to be determined. But we need as much political engagement and activation as you can bring. I honestly understand that I could be challenged for saying what I'm going to say next, but I don't know how any executive in any state criticizes HR1 in the federal government for making draconian Medi-Cal cuts while at the same time putting a state budget out that does the same damn thing. That's not something that most of us are proud of or appreciative of, but it is the negotiation that we're in right now. It will all come down to the pro tem, the speaker, 2 budget directors, 1 in each house, and the governor's team. So we need your help. Thank you very much.
Thank you, Senator Cortese. I'm going to turn to Assemblymember Aarons, and I just want to, before we head over, I want to thank our state delegation today for signing on to the advocacy letter to their respective state budget committee chairs that outlined the county's specific HR1 budget priorities. And I also want to thank Assemblymember Aarons for personally circling the letter amongst his colleagues. Thank you. And I turn to you now.
Thank you. Good afternoon, everyone. I'm Patrick Aarons. I'm the newest member of the Silicon Valley delegation. We have our work cut out for us in this budget and in the out years. I want to thank Supervisor Young and my county supervisor, Ellenberg, for their leadership continually. I was at a press conference earlier today where we talked about the importance of protecting our children and our families. And they also call me the most out of everyone, I think, to ask me what am I doing to help our county. And it is through their leadership that that I have prioritized the county budget ask. So I want to thank the 2 county supervisors. Of course, it's the 2 women county supervisors leading on these efforts to protect our families. I want to thank our county executive, James Williams, for your leadership, and David Campos and your entire team for just being so omnipresent in Sacramento and helping, frankly, helping a freshman legislator navigate I think I am the only member of the legislature here today who is on the Budget Committee. And so you can imagine the amount of requests that I am asked to push for and to champion and to preserve. And the county budget letter requesting support for preserving our enrollment in Medi-Cal is my number one ask to the Budget Committee. And thank the county. I want to thank Michael Elliott and the entire Measure A team. So many of our colleagues in Sacramento, we are hearing from them about going out for a ballot measure to replicate what the County Board of Supervisors led on this past year. And it is your example that the entire state of California is pushing for. It's by no means our saving grace. We do need to be united in our Silicon Valley delegation to push for these asks. And I especially want to thank Gene Cohen, our executive officer, and Marie Noel Fernandez and Kylie Clark for their testimony as well. I think that they've been amazing partners in my office and helping to properly bring all of us to the dais when we vote, when we advocate in our budget conversations. You've been incredibly helpful in helping not only explain the moral imperative that we have, but from how beneficial this is from an economic standpoint, which I think gets lost oftentimes in these conversations. I am the first legislator to be born at our county hospital, and I think that it is a responsibility that I take very seriously when I arrive in Sacramento as a member of the Budget Committee. And we're at an inflection point in our state budget. We can choose to throw our hands up and say that the federal government is cutting these draconian budgets and there's nothing we can do, or we can fight. And if we don't fight, then nothing will happen. But if we do, we can at least try. And I think more people in our county are understanding that we want to try. So it's time to start flipping some tables, quite frankly, and addressing these issues. And understanding that, there is class warfare going on in our county and our state, and it is pitting us against each other. But with all due respect to those economic arguments, class warfare has started long ago in attacking our poor and our middle class in exchange for heavier tax rates to our billionaires. I think as I was speaking with County Supervisor Ellenberg, the war in Iran has costed us close to $11 billion in 6 days. And we are projected next year to have an $18 billion budget deficit in the state of California. We can completely eliminate any cuts and restore fully all of our social safety net services in about a week and a half worth of going to war. And we need to keep talking about that as well, because these are policy choices that is happening in our country, and that is happening in the state of California, and that also needs to be at front of our minds. I'm proud to announce that I'm authoring a bill to protect CalFresh benefits for foster youth. I have 6 foster care bills that I'm advocating for. It's the most amount of foster care bills announced by any legislator since John Burton and Jim Bell. And I'm going to continue to be advocating for Medi-Cal and our county hospital system. I'm working closely with members of our health committee. I have just been appointed this year to the health committee, so I will be at the forefront of these issues. I want to especially thank and appreciate the leadership of close to 10 years now in the legislature, Assemblymember Clara, who has mentored me in and understanding and fighting for these issues. I want to thank Senator Cortese and Senator Wahab for their leadership as well in the Senate. It is not lost on me the responsibility that we have and the importance that we have. As I stated earlier in the press conference led by Susan Ellenberg and Betty Young, the cavalry is not coming. It is not the state needs to step up and save us. It is the mutual partnership that is going to get us through this. And the county, in our local government, and our state delegation, it is going to have to be us together. So when we use rhetoric and organizing, it is not, can the state help us? It is, how can we all help? Because if we led with that, we wouldn't have passed Measure A. Mm-hmm. We would have said the state just needs to help and figure this out. So please don't use that rhetoric. We need to use, how is everyone helping to solve and fix this? There are structural crises at hand that we need to continue to work on. I'm happy to draft those letters of support, and I want to thank my colleagues for so quickly signing on. But we have $85 billion in corporate tax breaks that we give out every year of our taxpayer dollars. Many of those we never review, ever review again once they are passed. Many of them are good. Many of them keep jobs in the state of California. Many of them protect good-paying union jobs and protect them in the state of California. But if we never review them, we don't. If the corporate tax breaks are doing such a good job at protecting families and good-paying jobs, they should have no problem coming before the public and explaining what a good job they're doing. And so I'm working in concert with Assemblymember Clara and reviewing our corporate tax structure and seeing what is working and what is not, in addition to looking at all options that can and should be on the table in terms of looking at revenue. But it is important that, again, we do not talk about revenue in a silo anymore. We do not talk about tax increases anymore without talking about the corporate tax breaks that we give out and how we can be doing things more efficiently and better together. And that is why I am here with county leadership, because we have to solve these issues together to have better delivery services for our most vulnerable residents, because these issues are going to be won and lost in every election cycle, and we cannot continue to allow our mutual constituencies to be at the whim of whoever is in the White House or whoever wins the governor's race. It needs to be us who are putting together our policy proposals and working together to streamline our efficiencies. And please count me as someone who wants to be in that fight with you all and bring all of you with me. And finally, I will just say the need for fully funding our IHSS and childcare slots that were promised to us. It unlocks our economy and will save us from future budget deficits. And so I've been pushing hard on fully funding our childcare slots as well. The Indian Health Center, Aki, Valley Med, where I was born, O'Connor, Sunnyvale Community Services are all organizations that have helped immensely. And as our county supervisors have said profusely, no wrong door policy in our county, where anyone who can go to any county facility can receive the help that they need. And finally, I'm going to text the governor a picture of all of you, and I want you to hold those Medi-Cal for All signs high. And I want to show Sacramento and our leaders that we are here to support and defend our community. Thank you. Okay, I'm going to take a video. 1, 2, 3. Thank you.
Thank you. You're going to tag all of us, right?
Well, I was just going to text it to Gavin, but I can post it too.
Yes. All right. Thank you to our state delegation. As always, you are our champions, and it's by no surprise and no mistake that as the Sons of San Jose, as former county supervisor, as someone born out of our own health system and raised by our child welfare system, thank you for fighting this good fight. Senator Wahab is online but experiencing technical difficulties that prevent her from being able to speak, but she is listening. And all of our office's staff are online and also in chambers to track the conversation. We're going to move on to item 4D, which is discussion. We have a handful of questions for our esteemed delegation, after which we go into public comment. So Vice Chair Ellenberg, I turn to you if you'd like to go first with your ask.
Sure. I'm going to give you a multiple choice here. I've got 3 questions that are related, so I'm going to blend them together, and then you can take whatever part of them you like. The first is, what is the appetite in the legislature to push back against a departing governor, specifically with respect to the Medi-Cal only program? Second, what is the appetite in the legislature to narrowly prioritize protecting healthcare and to treat this as the structural issue that has to be addressed before anything else, other than Prop 98? And third, this is the easy one, so please don't all pick this one. What more do you need from this community, and how can we help you all exert influence beyond the Santa Clara County delegation, best delegation?
I'm going to take the third one. I'm not because I'm chickening out, because I think there really is actually, in regards to, well, first of all, I think that some of the things that were laid out, including opposing the governors, for example, eliminating the Medi-Cal mobile crisis benefits, and things of that nature. I mean, we're gonna fight pretty much along lines of what folks here have been asking us, including our county leadership. But I just want to mention, because of the scale of HR 1, that we need to fight for revenue in a very meaningful way. And it can't just be cut, and hope that next year's budget is better, especially given what's happening at the national level. And so there are very meaningful things that we can do to advocate, because we get pushback in Sacramento from our colleagues, we get pushback from third-party interests, that are so hesitant to even hear the word tax, hear the word revenue generation in any form. But we have some really good ideas that are on the table. And one is a water's edge tax break that corporations get. And it basically has to do with whether they're taxed on revenues that occur onshore versus offshore. The bottom line is we have a very real possibility of getting that through if we have enough community rising up and saying, hey, corporations need to pay their fair share. And this is not something that will be passed down to us. It would bring as much as $4 billion a year. But another one I want to mention, which I think is a travesty, is the companies that, and we know who they are, rely on Medi-Cal for their workers and other state benefits and public benefits. We're basically subsidizing their business model, right? When you have a fast food worker only getting 20-hour shifts and they work 3 jobs, it's because those companies don't want to have to pay their health care. And so by pushing back on that, as Member Bonta is leading the charge on that, we can get as much as $17 billion a year from these companies, which basically means we're subsidizing them for $17 billion a year by charging a fee for what they're taking. So I want to mention that because it doesn't oftentimes get brought up, because politically it's very hard to do. But I think we're in a moment right now where we have to fight for our fair share from these corporations that have been fleecing us. And I think the timing can be good. So that's what I ask of our community is, in addition, I mean, you're already doing an A-plus job on advocating what this county needs, pushing back against the cutbacks, that we all are supporting you in that. I think in addition to that, I think there's a really big opportunity for us to create a mass movement to pass at least one, if not more, of these tax revenue generation matters, items. And so that's what I would say.
So respectfully, Assembly Member, I'm not opposed to increasing revenue, but we need to approve our budgets before the end of June. These things won't come into place
Fair.
until long after. And also, there's no guarantee that those additional funds will go to address the specifics of the current healthcare crisis. So I think in terms of a medium to long-term solution, these are really excellent ideas. I don't think they're sufficient in the short term to specifically address the crisis caused by HR 1. But I will absolutely support you on
Yeah, you're right, and that's
support
why
you on those efforts.
what the
but-
county is demanding
Yeah.
and what Assemblymember Aarons has put forward in the county request, absolutely we have to fight for those. I think that
Yep.
those are the short-term needs, 100%.
Thank you.
Thank you. And I'll just add, two quick things. Number one, I think that there are 22 freshman members of my cohort who are not going to wait 7 years for us to get seniority to do different things. We need to vote against the status quo. It's not working. It's not working in our healthcare system, and it's not working for our residents in Santa Clara County who are feeling the effects of the affordability crisis more than anywhere else. I will say that you all have, and to meet the moment in the urgency of what you are having to decide in months, not in a year. And the state legislature has acted in the past on early budget actions. We just last month, under the leadership of the Women's Caucus, my colleague, Senator Cortese, Senator Wahab, and the entire Silicon Valley delegation, passed a $90 million budget augmentation for Planned Parenthood and reproductive health care clinics because of the cuts from HR 1. And that became because of pressure and advocates from across our districts. And so early budget action items have been done and are also on the table into looking at more of those action items, knowing we cannot fully backfill all the cuts. But we are hearing you in terms of finding the urgency to backfill more of these cuts, which is why I have authored not only these budget letters, but my bill to backfill CalFresh and foster youth HR 1 cuts. We're looking at many other proposals to see if we can get you funds by the summer deadline. We are also advocating, Assemblymember Clara and myself, looking at when we pass our budget for retroactive payback budgets, so that even if you have to pass and make those difficult choices at the county level, that the state is looking at ways in which we can perhaps backfill any dollars that we can supplement in those critical areas, as well as looking at, by the way, Water's Edge, as well as some of the proposals that Mr. Clara mentioned, that does not increase anyone else's taxes. It simply can be a budget action that will immediately help alleviate these cuts and have virtually no impact on the average resident. Those are the solutions I am looking for. We have come and we have came to help. And our county, under your leadership, has saved us so much with the passage of Measure A. But it's time for us to look at the corporate taxes that we give out, and it's time to look at those solutions, as well as the ones that we've exhausted locally.
Thank you. Just two quick notes on that. It would be great if some of those tax cuts do happen, that they could be tied directly to HR 1 impact, so that there really is a nexus of the things that we're each talking about. And also immensely grateful for the support for Planned Parenthood, really critical work, but also just want to make clear that that doesn't help government budgets. Planned Parenthoods are private nonprofit organizations that receive some government funding but aren't government entities. So
right.
A phenomenally valuable expenditure, but just don't want to conflate that with funding that local government needs. Thank you.
Fair point. Thank you, Supervisor.
Senator Cortez, I'm going to turn to you before I'm going to sneak in my question here, and it's going to be an ask of our delegation. If we can we count on you to advocate for the county's HR1 related budget asks and to champion these asks if they are not addressed by the governor's May revision? I'm going to add that question in there.
Yes.
Yes, right.
Yes,
We
yeah.
got yes from Osh. Pat, on the record.
Hell yes.
Yes. Oh. Yes from Assemblymember Aarons, and then Senator Cortez, I turn to you. The mic is yours.
Yes, yeah, and of course, the letter that Assembly members Aarons and Clara have been talking about is exactly that. It's a letter directly into the budget process asking for those funds, and others have signed it too. So it's in the mix, and we'll continue to elevate it. Every opportunity we get. Whether I guess I'll take the question of whether I think there's appetite to push back against the governor. First level of response would be there always is, at least in my 5 years in the legislature. If we didn't push back against the governor, fundamentally, each and every year over the last 5 years, you have seen much more draconian budgets because, as I said earlier, the base budget that he puts out is typically a bargaining tool. So we spend from January all the way to June 15th, pushing back, fighting, and we'll continue to do that. There's a little bit of, someone was asking alignment questions earlier. There's a little bit of misalignment in terms of the how the state's viewing the HR1 impacts because of the way it's set up in tranches. And some of that is, as far as direct state impact, is not going to hit until 2027. And I, for one, have, at least, in our house, have been speaking up regularly about the fact that our local taxing entities, counties particularly, don't have the option of waiting, for the midterms or anything else, because you're going to have to make your cuts. You've already taken bold action on the revenue side, obviously in Santa Clara County with the recent tax measure, but you're going to have to make your decisions now. And the repercussions from those decisions are going to impact all of our constituents now, not in 2027, not after the midterm elections. There's a little bit of a disconnect there. And some of it is just fiscal because, like I said, the state is in the position to be able to wait a little bit longer than the counties to establish a response, a final response to HR1. I do believe, I think my colleagues have said it, that the tax measures that we're talking about, Water's Edge and the Medi-Cal backfill, there's really no delay there. We're trying to get those things done now. There's bills right now today you could advocate for that, if essentially would have urgencies on it because it required 2/3 votes anyway, so they can go to the governor when we have the ability and the will to get them there. What happens if he refuses to sign them or veto them? I think that's a political question all of us can speculate on, but I think we need to put him in that position. If we don't, shame on us. So the Medi-Cal, not to get overly into the weeds here, but if we go to corporations and charge them on essentially a per capita basis for the Medi-Cal that they're not reimbursing for today. Think of your favorite very large retailer who gives basically no benefits to their employees and is now at $1 trillion a year in revenue. Think about those guys. If we go to them and say, you're going to have to pay per capita for the Medi-Cal that you're costing us, that can only go to Medi-Cal at the state level. So I'm just trying to clarify that. So yes, that absolutely helps you. That doesn't go into some slush fund or get mixed up with the general fund. In fact, that's one of the reasons there's no Prop 98 share for that, because it wouldn't go to the general fund. It would go directly back to Medi-Cal reimbursement. And that's what we're advocating for. And many of us think that should happen now. So just want to clarify that. Thank you.
Thank you, Senator Cortese. Now we're going to head into the public comment portion of our agenda today. Thank you to our community advocates and our service providers and our caregivers who are here today. You being in these chambers means that you've stepped away from your daily role to advocate on behalf of your clients and your community. Colin, how many members of the public do we have?
We currently have 55 requests to speak in the room, and
It's a party. Let's do this.
We got 5 requests online.
Okay, so in accordance with the policies of our county, each public comment will be limited to 1 minute to make sure that everybody is heard. And if you have your statements in writing, you're able to also leave it with us as well. So, Colin, begin to call our members of the public.
Sure, I'll call you up in groups
As
of
you
5.
come up, just go straight to the lectern here. The mic is built in. Begin speaking. And if you're able to state your name before beginning to speak, that helps us track as well.
I
For good
have-
reason, not bad tracking. Good stuff.
Lauren Gasible, Rachel Montoya, Dawn Taylor, Bob Brownstein, and Barbara Estrada Reyes. Please approach the podium. And go ahead and start your comments whenever you are ready.
Am I on? Oh, I am. Okay. Lauren Gizable, Director of Behavioral Health with Garden Health Services. We're an integrated community health clinic that provides care to tens of thousands of unique lives throughout Santa Clara County. I'm here to talk about our peer respite and promotory staff. Assemblymember Ahrens, I appreciated what you said. Our peer mentors and our promotory staff are responsible for walking the clients into one of those no wrong doors. And right now, the current budget cuts are slated to eliminate a lot of those programs. What we're going to see is we're going to see a reduction in, and we're going to see loss of trust with a lot of the communities that they're responsible for serving. So our promotors and peer respite staff are members of the community that are designed to go into the community and bring those members into services. These are communities where the trust isn't fully there. And so they are responsible for bringing them to our care. If we lose them, we'll see increases in delayed access and decreased utilization, thus decreased revenue. So I really appreciate everybody's time. Thank you for everything.
Rachel Montoya, CEO of Community Solutions. We are a community-based organization serving individuals with serious mental illness, many of whom are in justice involved. Justice-involved individuals have uniquely complex needs. Some are incarcerated when they are better served in treatment, while others are navigating reentry into the community. Continuous access to health care is foundational to stability and successful reentry. H.R. 1 makes this significantly more challenging. Clients without coverage are at risk of hospitalization or reincarceration, outcomes that are more costly and deeply destabilizing and traumatic for the individual. Organizations like ours play a vital role in preventing these outcomes by providing care and stabilizing services, but we cannot do this without stable and sufficient funding. We stand with the county in urging the state to protect funding for critical programs so we can continue serving our most vulnerable community members with dignity and compassion.
Deep thanks to all of you for being here. I'm Don Taylor, CEO of Catholic Charities of Santa Clara County. And we work with community members in deep poverty and those experiencing significant economic challenges. Our impacts include supporting thousands of unhoused folks every week, both through food distribution and offering an address through our window services, essential for benefits and jobs. Offering deep neighborhood connections to our family resource centers and community centers. And all of this leads to serving hundreds per week with critical health services directly and through partnerships. Like our fellow safety net partners, we do this in the midst of funding reductions. And with each reduction, it impacts those who are impacted most. So with the fiscal challenges upon us, I thank you all for your consideration and your policy decisions, which are essential to impacting the services that we provide. And we do it together. Appreciate it.
Bob Brownstein, if you need help in your fights with the governor or with other legislators, sound the alarm and we will be there with righteous ferocity.
Good afternoon. My name is Barbara Estrada. I am a CHW. I came here to ask all of you to keep the medical expansion for all. I'm sure you are aware that Santa Clara County has a significant population living with chronic conditions. It's critical that they have access to comprehensive healthcare services, regular checkups with their PCP, dentists, ophthalmologists, podiatry, health education to help them effectively manage their A1C levels. These specialty services are not just important, they are an essential part of their ongoing treatment and well-being. Access to these services must be maintained. Without access to ongoing care, these individuals face serious consequences like needing dialysis or even amputation of their limbs. As a CHW, I have seen a patient that waited nearly a year for surgery and now told it's no longer possible. I leave my documentation.
Thank you. Can I call up Yadil Lopez, Sandra Asher, Guillermo Vieros, Guillermo Calvo, and Rosie Gomez, please.
Hola a todos. Mi nombre es Yadel López, trabajadora comunitaria de la salud en Community Health Partnership. Primero que nada, gracias por todo su apoyo. Estamos en el inicio del cambio de medical y ya está experimentando la necesidad extrema de acceso a coberturas de salud a nuestros miembros de la comunidad, donde algunos de ellos están siendo afectados en el acceso a tratamientos de salud mental, salud emocional, entre ellos la consulta de detención y prevención. Escuché el caso de una de nuestros pacientes que perdió la cobertura de salud proveída por su empleador y sus servicios de salud mental fueron interrumpidos. Con los nuevos cambios de medical, tampoco podrá tener los accesos al servicio necesarios, ya que por falta de un estatus migratorio satisfactorio no podrá ser elegible para medical. Este es solo un caso entre muchos de otros. Apoyen a Medical para Todos. Tener acceso a servicios de salud conductual disminuirá la posibilidad de visitar una sala de emergencias. La salud es un derecho humano. Gracias.
And one moment for translation services.
Translation?
Hi, can you hear me?
Yes, go ahead.
Hi, my name is Aida Lopez and I am a community worker. First of all, I would like to thank you. I would like to thank you for supporting us. And since we are starting to see the changes in medical, but we are experiencing the needs in the community. We have been helping the community health services, emotional health, and I have heard a case of a person that has lost the coverage that was given by her employee, and also she has lost the medical health coverage. So, and also, due to the fact that she's not having a migration status, she wouldn't be eligible, and she wouldn't have any access to these services. So let's support medical. Let's support everything for us because health is a right. Thank you.
All right. Thank you. My name is Guillermo Veros. I'm the CEO for Gardner Health Services. Thank you for allowing me to speak. I think the first thing I'd really like to thank the county on the deep partnership we're having as we go through this process. Again, not only on the primary care side, but also on the behavioral health side, complete support what they're putting forth. But again, I really do appreciate the transparency, the collaboration that we're seeing as we go through this process. I think the most pressing issue that I see, and I think is consistent with what people said, is really how do we address the unsatisfactory immigrants, patients, and clients that we're seeing. Those are the ones that are at risk of losing access to primary care and behavioral health, both on the funding and services perspective. That's by far. And again, it's a fiscal challenge. It's not a demand challenge. I think it came up with other folks, and that's kind of what it is. Well, I'd like to leave you with a specific example. And thanks to actually the data provided by the county. For us on the primary care side, if we lose access, our PPS rates will go from, well, basically it impacts 37% of our patients. The overall dollar amount for us is $11 million.
I am so sorry,
Your time is
Guillermo.
up.
Please leave your statement with us. Yes, I will allow applause today. It's a special meeting.
My name is Sandra Asher, and I'm here to urge the state, do not make funding for community-based mobile crisis services optional under Medi-Cal. For families like mine, this care is essential. Over Valentine's Day weekend, my son, who's out of state, became suicidal, said goodbye, and disappeared into the mountains. With no civilian crisis team available, our only option was law enforcement. They found him terrified, curled up in his car, and left him there without care. It didn't have to be this way. We know community-based mobile crisis teams made up of crisis counselors and peer specialists are more effective, less dramatic, and more cost-efficient than police response. They connect people to care and reduce long-term systems costs. Most importantly, they are safer. People in mental health crises face higher risk of harm during police encounters. This isn't a system we should rely on by default. Please fight to keep this funding mandatory. Thank you.
Hola, muy buenas tardes a todos. Mi nombre es Daisy y soy miembro de la Unión de Trabajadoras de Comida Rápida. Estoy aquí para expresar mi firme apoyo a las solicitudes del condado ante el Estado, ya que nuestros hospitales son públicos del condado y actúan como gran seguridad para todos. El condado ya hizo varios cortes profundos y ahora necesitamos que el condado o el Estado investigue para proteger a nuestros hospitales. Los hospitales públicos del condado me han dado el cuidado necesario sin rechazarme por no poder pagarles. En mis momentos más difíciles puedo encontrar con nuestros hospitales del condado y esa es la realidad de muchos trabajadores en nuestro condado. Todos merecemos atención médica. Por favor, apóyennos a la solicitud del condado al presupuesto estatal para proteger nuestros hospitales. Yo estoy en riesgo de poder perderlo. Yo tengo salud mental también y corro el riesgo de poder perder mi medical y también con relación a lo general. Muchas gracias.
Thank you. We're going to pause for translation, but please step forward with translation.
Can we ask if she's
I'm getting no
there and hearing
response
us?
from, is there any translation available?
I'm sorry, I was talking to myself. I'm so sorry. I'm going again. Good afternoon, my name is Daisy, and I belong to the Fast Food Workers Union. I am giving my full support to the county against the state, and I would like to have the public hospitals fully protected for us. The county has had deep cuts lately, and it's the time for the state to protect our public hospitals. I haven't had any money in the past to pay, and no public hospital has ever rejected the service for me. And that's the reality of many workers in the county. We all deserve medical health. We all deserve medical attention. We need to protect our hospitals. And I would like you to know that I'm in risk of losing my mental health service, and therefore I'm probably losing my Medicaid. Thank you.
Thank you. Please come forward and begin speaking.
Hello, everybody. My name is Guillermina Calvo. I come in from the fast food worker. Estoy aquí para apoyar la solicitud del condado ante el Estado, es urgente que protejamos nuestros hospitales públicos. Yo soy una de esas personas en nuestra comunidad que dependen de nuestros hospitales públicos. La semana que viene me van a hacer una cirugía de mi ojo izquierdo, que si no fuera por los hospitales no podría yo cubrir con el seguro médico que yo tengo. Me van a operar en el hospital de O'Connor. Es la segunda cirugía que me hacen. El año pasado me operaron del ojo derecho y ahora me van a operar del ojo izquierdo. Estoy muy agradecida y estoy aquí para que nosotros les sigamos brindando y pedirles que apoyen a que no vayan a cerrar los hospitales porque son muy importantes para la salud de nosotros los trabajadores. Gracias.
And if I could have Lilia Caro, Vaughn Villaverde, Sarita Coley, Anna Fernandez, and Chris Gonzalez please approach the podium. Thank you.
In translation?
I'm here to fully support the county against the state, and I would like you to know that it's urgent to protect our public hospitals. I am one of those persons that are fully dependent on public hospitals. Next week, I will have a surgery in my left eye. And if it wasn't for the public hospitals, I wouldn't be able to pay. Last year, I had a first surgery in my right eye, and next week I will have the following surgery of my left eye. So I'm really grateful. I am really grateful. I would like to fully support you, and please don't let our public hospitals close because they are important for us workers everywhere. Thank you.
Please.
I'm Lily Icard. Listening to this conversation about cuts to critical health care, I'm struck by how interconnected these issues are with our schools. For many families, schools are where children access meals, basic health supports, and stability. And so I would like to tie this to another critical issue that our community is facing: the proposed closure by San Jose Unified of 5 elementary schools serving some of our most vulnerable children. I want to speak to this today because many of you either endorsed or donated to current trustees Magana, Wheatley, Collins, and Castellanos, and so your voices carry real weight with the trustees. Families and community members have been participating in the Schools of Tomorrow process and speaking to how elementary school closures could amplify these cuts for the families who depend on them, but do not feel like the district or the Board of Education is listening to them. San Jose Unified is not in financial distress, and the district has said the proposed elementary school closures will not save money. But the option in front of the board closes 5 schools serving some of the highest concentrations of Latino and Black students in the district, and yet the district has not done an equity or an impact analysis. We know this decision ultimately sits with the board, but your voice.
Good afternoon. My name is Vaughn Villaverde, and I'm Director of Advocacy at ACCI, and I'm here to voice ACCI's strong support for the county's efforts to preserve and sustain the healthcare safety net. Current and anticipated cuts to behavioral health are forcing clinics like ACCI to delay filling staffing vacancies, which combined with staffing shortages at the county and our sister clinics are leading to longer wait times, reduced outpatient capacity, and fewer case managers and support staff across the county. Even when programs remain, reduced staffing means fewer patients served, longer days, and increased risk for burnout within our teams. These challenges are exacerbated by state reforms like the transition to BHSA, which is leading to less funding flexibility for mild and moderate mental health care and PEI services, along with state cuts to Medi-Cal, which are destabilizing the entire system. We urge the committee and the board to continue its difficult work of preserving funding for these critical services and thinking of new and creative ways to address the growing behavioral health needs of our communities. Thank you.
Good afternoon. I'm Sarita Kohli, CEO of ACCI, and we have primary care and behavioral health clinics in all of your districts. And I'm here to also voice my strong support for the county's budget asks of the state. Like the county, ACCI is bracing for the impact of the cuts to Medi-Cal, and particularly for the UIS population, which will make it challenging for us to fulfill our mandate to serve everyone regardless of their immigration status or ability to pay. The primary care patients that we see at community clinics like ACCI typically have very complex healthcare needs due to the inconsistent access to care and socioeconomic challenges. And while we have made huge efforts to enroll community members in Medi-Cal before December 31st last year, we now are facing tremendous cuts to the PPS starting in July, which would be devastating for us. Most of the community clinics have at least 30% UIS populations, which would be financially totally destabilizing. So thank you for doing everything you can to save this.
My name is Anna Fernandez, and I am the Executive Director of Behavioral Health at Hope. We assist people with developmental disability and mental health needs. For many of these individuals, medical is just not an insurance, it's their lifeline. This medical provide access to behavioral health, psychiatric support, medication, crisis service, and daily living support that allow this population to be stable and live in our community. When these services are reduced, individuals lose their stability, family lose support, and the system shifts from prevention to crisis. And then we see increase in emergency room visit, more hospitalization, more involvement with the law enforcement, and this specific population end up in locked facility at the state hospital that cost much more of the service that I just mentioned before.
I can get Chris Gonzalez, Gail Wright, Michelle Liu, Perla Flores, and Olga Mello to please approach the podium.
Afternoon, my name is Chris Gonzalez. I am a substance use social worker for youth at Health Right 360. Silicon Valley depends on a strong workforce to build our future. Yet right next door, many young people and families are struggling with substance use disorders and homelessness. Too often, without support, these challenges push youth into the carceral system instead of opportunity. Substance use services prevent young people from being trapped into systems and punish rather than heal. They give youth the tools to imagine and build better futures. I want to share a story of a young person, pseudonym Hector. He grew up in poverty, entered in probation at age 13, struggled with addiction. Today, he's 19 years old. With consistent support and healthier coping skills, he maintained sobriety and completed probation. Community-based care made that possible. When we cut substance use funding, many of them are Medi-Cal, we are pulling the ladder from under the youth to stay clean and housed. True progress means protecting treatment funding for—
Thank you. Thank you so much. And you can leave your statement with us as well. We'll enter it for the record.
Good afternoon. My name is Dr. Gail Wright. I'm a pediatrician and a pediatric cardiologist and pediatric critical care physician. I've worked in this county providing that care for 22 years of my 33 years caring for children. And I came today to thank the county for all you continue to do, to thank our state legislatures, and to ask that we continue to prioritize care, and particularly the care of children. I wanted to tell a story of one of my patients. I can't do that in 30 seconds. Others have emphasized how much we save money by providing early care, but our best examples are sitting right in front of us here with two babies born in our safety net hospital who, when they were given education, food, at least one adult who cared about them, and a later education, are able to be our leaders. And the opposite just described by our prior speaker. I also just want to say to Santa Clara County that your doctors still love you. And we're doing all we can. So let's do this together, please.
Thank you.
Good afternoon. My name is Perla Flores, and I oversee gender-based violence services for Community Solutions. And we're grateful to the county for its initiative and leadership, particularly in advocating that the state contain a VOCA backfill in its 2026-2027 budget, and also requesting full cost recovery for large sporting events. VOCA represents a critical funding source for Santa Clara County's confidential domestic violence sexual assault service providers. In fiscal year 25-26, the state VOCA backfill amounted to nearly $2 million for domestic violence sexual assault providers. And we also want to acknowledge that Santa Clara County has a long and important tradition of investing in critical safety net services for gender-based violence survivors. including going back to Senator Cortese, championing increasing funding for human trafficking survivors at the county level, and appreciate that leadership continued today. Thank you, Supervisor Young and Supervisor Ellenberg, and we look forward to partnering with county and state leadership to address this issue. Thank you.
Good afternoon. Michelle Liu, Senior Vice President with Stanford Medicine Children's Health. You might be asking, what's Stanford doing here? At Stanford Children's, our payer mix is more than 40% Medi-Cal. So as Assemblymember Ahrens mentioned, we are all in it together. Santa Clara Valley Healthcare is our partner. We love you, we love the leadership of Paul Ahrens, and we're here to support a strong county-state partnership. Thank you.
And if I can get Olga Mello, Ava Cruz, Jaria Java, David Mineta, Andrew Siegler, Raymond Goins, and Michelle Mashburn, please.
Buenas tardes, supervisores. Mi nombre es Eva Cruz. Soy promotora de salud de Community Health Partnership. Vengo a pedir, por favor, mantengan los servicios de Medical para todos en nuestras comunidades. En 2025, Medical pudo lograr una mejor salud, mejor estabilidad para nuestros niños sobre todo. Nuestra salud y las familias son el primordial de esta comunidad. La comunidad se siente muy agobiada, ya que minimizar los servicios de Medical crearía un impacto físico, pero principalmente emocional, ya que ahorita muchos de nuestros jóvenes se encuentran padeciendo esta situación mental que necesitan acceso a todos los servicios. Si nosotros perdiéramos el servicio completo de Medical, pegaría muy fuerte en nuestro bolsillo económico, ya que no tendríamos acceso a un servicio público, sino a un servicio privado que es difícil de mantener. Recuerden que nuestra salud es un derecho, no una elección. Gracias.
Thank you. Translation.
Good afternoon. My name is Eva Cruz, and I am member of a health community. And I would like you to keep the medical, please. In 2025, we had a better chance to improve health, to improve stability for our kids. And we know in our community, health and family are at the center. Our community is really concerned because medical might disappear. So this is not only having physical impact, but also emotional impact. It will be, of course, a really hard impact in our economy because we will not be able to pay, to have a public service, but we will be forced to pay a private service that sometimes or maybe we won't be able to pay. Please, health is right. It is not an option. Thank you.
Please come forward.
Hello, I'm a member of Fuerza Colectiva. My name is Flora Hernandez, and I'm speaking in strong support of the county's budget request to the state. Our county's public hospital are the safety net for everyone in the community. The county has already made cuts, and now it's time for the state to step and protect our hospitals. I care about the county's public hospitals because they provide health care for everyone, especially for our most at-risk population. They are the only place where our uninsured neighbors, the homeless, and the working families who are just barely getting by cat turn to when they are sick. Without these hospitals, these people would have nowhere to go. Please support the county's budget in the state budget to protect our public hospitals. Thank you so much for your support and commitment.
Hello, everyone. Thank you so much for your leadership and for hosting this wonderful committee hearing. My name is Jiraiya with Working Partnerships USA, and I'm urging the state to support the county's budget asks. I'm working every day to educate the public about the changes to Medi-Cal, and during this work, I actually met a young immigrant mother whose entire family relies on Medi-Cal. She works 2 jobs to keep her family afloat, all while caring for her 2 children on her own. With the new changes to Medi-Cal, like the 6-month renewals and the loss of dental care, she's worried that she'll lose the one program, Medi-Cal, that supports her family and her family's medical health. So please support the county's budget asks and protect our safety net and public hospitals. Thank you.
Good afternoon. Thank you for the opportunity to talk. My name is Drew Siegler, County D2, Assembly D25, Senate D15 resident, community organizer, and I'm on disability due to mental health diagnosis. Please fight for the county's recommendations, and please don't make funding for mobile crisis response optional. In 2017, I was in crisis for my first 5150. I agreed to get help. The doctor told dispatch, do not send the police. He's cooperating. 8 officers showed up. Terrifying. Families who lost loved ones to police violence during mental health crises fought for and designed trust, our county's non-law enforcement crisis response, so people like me could be met with care, not guns. I haven't been hospitalized in 5 years, but I'm always just one bad day away. I support the county's recommendations, and especially please do not make mobile crisis response optional or shift its costs to counties facing historic deficits. The decision will cost lives, including mine. Thank you.
Next up, we have Michelle Mashburn, Megan Goodhue, Arcelia Gonzalez, Irma Quintero, Natasha Walker, and Beatrice Walton.
I think this one's on. My name's Michelle Mashburn. I'm an IHSS recipient, founder of All Things Disability Equity. I'm also a public authority IHSS advisory board member. Today I'm speaking as myself. Disabled people in this county are not a uniform group waiting for services. We are employed and unemployed. We are parenting, running businesses, organizing, and contributing in every sector of civic and economic life. We are also disproportionately among those directly targeted in these cuts. IHSS recipients, providers, waiver service recipients, and disabled people locked out of traditional employment, not because of their disabilities, but because of structural ableism. These cuts will lead to institutionalization and also will lead to death of people with disabilities. And it needs to be recognized within this county. I appreciate the county and the state's delegation's commitment to protecting the communities during this moment, and I urge you to carry the voices of disabled people forward.
Good afternoon. My name is Megan Goodhue, and I'm the Manager of Advocacy and Community Engagement at Parents Helping Parents, where we serve thousands of families with loved ones with disabilities across Santa Clara County. I'm here to urge you to protect in-home supportive services, or IHSS. IHSS is critical to keeping people safely in their homes and out of costly institutional care. Proposed state cuts, like eliminating the backup provider program and restricting services during Medi-Cal gaps, will have real consequences locally. Without reliable care, people will go without basic needs and end up in crisis. When that happens, the burden shifts to our county, impacting hospitals, emergency services, and safety net programs. I urge the county to be prepared to fill these gaps if needed, and I strongly urge our state leaders to reject these cuts and fully fund IHSS. Protecting IHSS means protecting the health, dignity, and stability of our community. Thank you.
Hi, good afternoon. I'm Natasha Walker. I'm with I'm representing IHSS SEIU and advocating also for families with disabilities like my own, because I have a daughter with autism. I actually have some suggestions. So I wanted to say, first of all, for our state legislators, please, while in your conversations with those who are opposing you, use the opportunity to educate them on how invisible those with disabilities truly are. allthingsdisability.org can help you with that. That was Michelle Ashburn, who was just here. She actually has a website. Also, there are foundations in the state that just sit on their funds. So that's another place to look. And look at the county and state agency operating efficiencies. Employees can help you with that, and so can consumers. And leaders of organizations, please do the same. Train your staff in emotional intelligence too, because there are 2 women sitting in this room right now who just became homeless. Okay, thank you.
Buenas tardes, mi nombre es Irma, muy orgullosa de pertenecer a la Unión CSEUI 2015. Como sabemos, el condado ya le hizo grandes recortes al presupuesto y ahora es momento de que el Estado intervenga para proteger a nuestros hospitales. Me preocupo porque soy una trabajadora del Servicio de Apoyo en el Hogar IHSS, así como el cuidado en el hogar. Los hospitales públicos son muy importantes para mantener seguras y saludables a las personas de nuestra comunidad. Estos no solo son servicios básicos, son servicios que le salvan la vida a las personas de nuestra comunidad. Esto incluye a las personas como mi madre, que depende del servicio de cardiología en el Hospital O'Connor para mantener su salud y bienestar. Debemos de trabajar unidos para luchar contra los recortes HR1 y proteger los servicios esenciales como lo son los hospitales públicos. Por favor, apoyen al presupuesto del condado en el presupuesto estatal para proteger nuestros hospitales. Thank you.
Thank you. We're in terms of translation, and I know that our meeting has ran over time. I appreciate everyone sticking it out with us. Some of our staff members will be moving on to the next meeting today, but everyone's taking notes, and we have our staff in the audience taking notes to make sure that this is all reviewed as we head into the budget process. Please, Rebecca, begin. Oh, wait, no, I'm sorry. Translation. Yeah.
Thank you. Hi, my name is Irma, and I'm a very proud member of the union SEUI 2015. And as we know, the county has had a lot of cuts, and it's time for the state to protect public hospitals. I am a home worker, I'm a member of the IHSS, and we all know public hospitals are really important, and they are essential for keeping our community healthy. This is a basic need, and it is also saving lives, like my mom, that is also dependent on the cardiology service and the O'Connor Hospital. So we need to work together to avoid cuts, because this is essential. Public hospitals are essential. So I will urge everyone to support the county for this. Let's protect our public hospitals. Thank you.
And next up, we have Ofisa Patty, Chris Scott, Kimberly Wu, Cindy Batista, and Carmen Montum. Please approach the podium.
I'm reading this today on behalf of Yurina Guzmán. Buenas tardes, soy organizadora comunitaria con Latinos Unidos por una Nueva América, pero hoy estoy aquí como madre y como testigo directa de lo que significa tener o no tener acceso a atención médica. En el año 2010, mi hija fue diagnosticada con un tumor cerebral. Después de una cirugía en Lucille Packard, ella sufrió un derrame cerebral que la dejó en estado crítico. Mi hija perdió movilidad, visión e independencia. Meses después fue trasladada a Valley Medical para cuidados paliativos. Y ahí entendí algo que hoy quiero que ustedes también entiendan. Los hospitales públicos no solo son edificios, son la diferencia entre rendirse y seguir luchando. Gracias al gran equipo, mi hija no nomás sobrevivió, pero hoy camina, hoy está de pie y está a punto de graduarse de la Universidad de Santa Cruz. Gracias.
Translation, please.
This is on behalf of somebody else, and hi, I'm a member of the community of Latinos Unidos, and I'm not only here as a member of the community, but also as a mom and a witness. Having or not having a public health service is really important. In 2020, my daughter was diagnosed with a brain tumor, and he needed a surgery. After that surgery, he had a critical status. He lost mobility, he lost her independence, and then she was transferred to another public hospital. After that, public hospitals are not just buildings. It is the big difference between giving up or keep on fighting. And thanks for the big team in the hospital, my daughter was able to continue. I was able to survive, and now she's able to walk. She's able to stand up by herself, and now she's going to get graduate in the University of Santa Cruz. Thank you.
Good afternoon, Board of Supervisors. My name is Arcelia Gonzalez. I'm a proud member of SEIU 2015. And I'm here speaking in strong support of the county's budget's request to the state because our county's public hospitals are safety nets for everyone. The county already made deep cuts, and now it is time for the state to step in to protect our hospitals. I care about the county's public hospitals because I had a patient previously about 2 weeks ago, and she had an intestinal infection. And I had to rush her to emergency. And she had, she was cared for by her medical insurance. And cases like this, I have them often. And it'd be sad if they didn't have insurance. And they provide health care for everybody, especially for most vulnerable population. Thank you so much.
Hi, my name is Beatrice. I came up here before to speak on behalf of myself and my sister. We recently became homeless. I got her in my care after years of drug abuse and homelessness. She's finally home, but I had to take on responsibility for her, and in the mix of that, I had to stop working and pick up a job for IHSS as her care provider. At this time, I have not started getting paid until March. I started in December, and so without pay, fell behind in rent and got evicted, and so we're now homeless, and we're staying in extended care using the money that I have to provide a place for us to stay. At this time, we have her on Medi-Cal. We're trying to get her treated and part of Silicon Valley independent living, but Medi-Cal is what's going to cover her. We'd have to find out if she's covered under Medi-Cal to be able to receive the services. So keep Medi-Cal.
Good afternoon. My name is Ofisa Pati, and I am the advocacy lead at ACI, where we provide services to survivors of gender-based violence. As we continue strategizing about preserving the safety net, it is important to remember services for special populations like survivors of gender-based violence. Gender-based violence is not just a public safety issue, it is a public health issue. When survivors cannot access services, the consequences show up in emergency rooms, in mental health crises, and in families that never got the chance to heal. Cuts do not make the needs disappear, they make it costlier to address in the future. While we are thankful to the county for its continued support of gender-based violence services, we are calling on elected officials to take action, particularly because there is currently no mention of VOCA backfill funding in the state budget. VOCA funding is the cornerstone of how many organizations like ours are able to provide services to survivors, and its absence from the budget is not an oversight we can afford. Thank you.
Good afternoon. My name is Chris Scott. I'm with Fresh Lifelines for Youth, also known as FLY. First, I would like to thank Assembly members Clara and Aarons for their advocacy recently for extending prevention through CalVIP funding and writing a letter to the state. Recently, under BSCC, funding for prevention was awarded throughout California, and zero funding went to Santa Clara County, county-based organizations, or local governments. Zero. More advocacy is needed here, especially when funding is available. We should all be outraged. Furthermore, how are we going to show the state that prevention resources is an important need when our own county is quick to cut prevention first? Let's prioritize prevention together. Thank y'all.
Good afternoon, everybody. My name is Cindy Bautista. I'm the Pasos community organizer at Sacred Heart Community Service. I'm speaking strong support of the county's budget request to the state. Our public hospitals are essential safety nets for everybody in our community. The country has already made deep cuts, and now it's time
to the state to step in and also help to create critical services. In our Pasos committee, we support seniors that are mixed status families who are already experiencing high levels of stress, many of them now at risk losing limited health care coverage that they depend on. These seniors live a long-term illness and rely on our clinics and our hospital for ongoing care. Please support the county's budget request in the state budget to ensure our public hospitals remain available for those who need the most. Thank you.
Good afternoon. I'm Kimberly Wu, and I'm with Siren. When the federal government stole $1 trillion worth of tax-funded money to reinvest $170 billion into the malicious family separation agenda, our county's budget request to the state on funding public hospitals, that's how we fight back, along with immigration legal funding that Siren and partners are advocating at the state level. Siren will soon release a report with SJSU Human Rights Institute. And across the board, our immigrant families are overwhelmingly worried about affordable housing and health care. Our immigrant families are figuring out where their hard-earned but often limited money goes to. Food on the table, roof over their heads, health care for their lives, attorneys to keep their families together, and the list goes on. It's an impossible decision as all are interconnected, and sacrificing any would mean one step closer to our entire community collapsing. We urge our state officials to invest in public health care and immigration legal assistance to keep our families together. Thank you.
We have Carmen Martinez, Samantha, Adriana Garcia, Susanna Buragos, Peggy Elwell, and Greg Miller, please.
Good afternoon. My name is Carmen Martinez, Patient Organizing Director with Latinas Contra Cancer, speaking on behalf of Executive Director Darcy Green. We are patient navigators, health educators, and health justice advocates, serving thousands of clients who are directly impacted by HR 1. We see every day what is at stake. This is an urgent moment. Our patients' lives and the lives of Santa Clara County residents are on the line. We work with people facing cancer and serious illness, and we know what happens when care is delayed, denied, or disrupted. Patients get sicker, outcomes worsen, and the strain on our entire health and hospital system grows. The county has shown courage and collaboration in protecting our safety net, but they cannot shoulder this burden alone. We now look to our state delegation as essential partners. The state has a critical and time-sensitive opportunity to act, and the consequences of inaction will be immediate and harmful. We are prepared to organize our community to preserve the funding needed. Thank you.
Good afternoon. My name is Samantha, and I'm a lead patient organizer with Latinas Contra Cancer. I'm here today because what we are hearing from patients is deeply alarming. People are scared, they are sick, and many are losing faith that anyone in government will step in to protect them. Every week, our team speaks with cancer patients and families managing serious illnesses. We are seeing more people becoming uninsured, more patients canceling or delaying appointments, more people telling us they are afraid to return to care because they simply do not know how they will pay for it. Patients come to us because we have become the bridge between the community and the systems that hold power over their health. When trust in government breaks, they turn to the people who are still listening, which is us, trusted community orgs and partners. The consequences of HR 1 will fall hardest on the families we work with every day, families already fighting for their lives. They cannot withstand another barrier to care. Thank you.
Good afternoon. My name is Adriana Garcia, and I'm with Latinas Contra Cancer. And I am the health educator, and I work with promotoras. I witnessed the courage of women who survive cancer or other illnesses, community members who want to return to educate our people. They personally know what delayed or disrupted care looks like. They know the fear of waiting, the pain of being denied, and the difference it makes when a system truly supports you. Their experiences remind us why this is so important and urgent. The county needs extra love and support from the state to protect our health and hospital systems that is essential for those most impacted by illness, inequity, and economic hardship. We are here to make an ask that the state delegation to become critical partners in this work. This is about our entire community's well-being. I hope you consider what we all have had to say here today. Thank you.
If I can get Andre Oliveira, Delza Gonzalez, Sean Allen, Natasha Walker, And Chris Demers, please.
My name is Greg Miller. I'm with the Santa Clara County Single Payer Healthcare Coalition. I'm a retired nurse, and I want to, first of all, support the idea of raising money through taxing corporations for their bad treatment of workers and making people go on to Medi-Cal. But also, I want everybody to look at the longer-term situation. We need to get, we need a single-payer system. We need a system where that guarantees health care for all residents, comprehensive health care. You know, the care that we're talking about right now, we're trying to save, you know, we need a single payer system. And we have a bill in the legislature called CalCare, AB 1900, and I really encourage the legislators and also the county folks to support this bill, because this would really solve our problem.
Hola, muy buenas tardes. Mi nombre es Susana Burgos, navegadora de pacientes en Latinas contra el Cáncer. Represento a una organización que trabaja directamente con pacientes y familias en el condado de Santa Clara. Nuestra comunidad ya está bajo una presión inmensa, aunque valoramos mucho los 330 millones de la medida A. En realidad apenas cubre una fracción de la deficiencia, ¿verdad? De 1 millón que enfrentamos como miembros de esta comunidad. Vamos al condado y hemos agotado todos los recursos locales en el estado de California. Debería de invertir ahora para evitar un colapso en los servicios de salud y la alimentación. Al contrario, el aumento de personas sin seguro médico genera una crisis humanitaria y mucho más a largo plazo, ¿verdad? Y proteger a nuestra comunidad, yo pienso que es nuestra. Gracias.
Good afternoon. My name is Susana Burgos, and I belong to Latinas contra el Cáncer. And now I have been working a lot with families and patients in Santa Clara County. We have exhausted each and every local resource, so it's time for California to invest in order to avoid the collapse for food and health. There has been a lot of issues. People are losing their insurances or this Social Security, and this means that we will be in a human crisis in the long term. So please help us to protect our hospitals. Thank you.
Hello, Board. First, I want to start by thanking our legislators for being here today, not only to hear our concerns, but also for the support that you guys gave us in the Capitol. My name is Andre Oliveira. I'm a janitor at O'Connor Hospital. I'm also the chair of COPE and chapter vice president of SEIU 521 here in our county. I'm deeply concerned with the access of healthcare in our county at this moment. I said it before, and I'm going to say it again. This is going to be remembered as a dark moment in the future healthcare of our community. A lot of us in this room have done our part to have Measure A passed. And we know that at the moment, the county has to do hard decisions to keep our public health system sustainable and operational. I come here to urge the state to do the right thing and do their part and provide as much resources as possible for us to keep taking care of our community. Thank you all.
Good evening. My name is Lisa Gonzalez, and I am the organizing director with Sacred Heart Community Service. I am here in strong support of the county's budget request to the state because our public hospitals and medical and healthcare are a safety net for everyone. I care deeply about this issue because I see firsthand the stress and instability families experience when trying to access healthcare, especially our youth that are turning 18. I have an 18-year-old daughter who is a full-time college student working part-time, and she is already worried about whether she will be able to afford her medical care or not. My second daughter is about to turn 18, and her father has said he will remove her from his insurance because it's getting too expensive. She had a major mental health breakdown during this time. The stress of this uncertainty really caused her this breakdown. These are just my children. Now imagine what other young people are going through as they try to navigate a system that feels out of reach. Healthcare should not be a luxury, it's a human right. Thank you.
If I could have Sean Allen, Carol Garvey, Teresita Garcia, Hui Tran, Cassandra Morgana, and Amanda Flores, please.
Good afternoon. My name is Sean Allen. I serve as the president of the San Jose Silicon Valley NAACP. I'm here today because the impending federal budget cuts aren't just numbers on a spreadsheet. They are a direct threat to the health equity of our community. Our public hospitals are the primary safety net for the families I represent, many of whom already face systemic barriers to quality care. The county has already made deep, painful cuts to keep the doors open. We are now calling on the state leaders to step in and bridge that gap. This is about more than just a budget. It's about the civil rights to accessible health care. We urge you to fully support the county's budget ask. Wow, I'm doing early. And lastly, to your point, sir, I really appreciate you bringing up Iran. Today is Persian New Year. Saleno Mubarak. Thank you.
Muy buenas tardes, supervisores. Mi nombre es Teresita García. Soy promotora de la salud de CHP. Y estoy aquí para pedirles que mantengan el medical para todos, por favor, ya que nuestra comunidad con situación migratoria no satisfactoria sufre de enfermedades crónicas como la diabetes. Y aún sufrirían al no tener un doctor primario. Estos cambios hacen más difícil acceder a los servicios esenciales para la salud. Por ejemplo, al no poder ir a hacerse pruebas de laboratorio, podrían salvar su vida. Tomen en consideración a estas personas cuando tomen decisiones. El pueblo los eligió para representar nuestra voz. La voz de los que más necesitan, ya que nosotros no tenemos tanto poder como ustedes. Muchas gracias.
I could get Jeremy Bruce, Mary Gloner, Roberto Gonzalez, Joseph Cooper, and Flora Hernandez, please.
Good afternoon. My name is Teresita Garcia, and I am a CHP health promoter. And I'm here for asking you to keep medical for all, especially in our immigrant communities with not satisfying status because our community is suffering of illnesses like diabetes, and they would suffer if primary care is not available anymore. Many of them will have a lot of difficulties having access to health. For example, we all know that lab tests are critical for saving lives. So we want you to consider this type of population when you are choosing what to do. We chose you to be the voice of the unheard. We want you to protect our people. Thank you.
Good afternoon, Honorary Board of Supervisors and invited guests. My name is Dr. Joseph David Cooper, and I'm an infectious diseases doctor and HIV physician at Santa Clara Valley Healthcare. I chose to work at the county after fellowship training because I was drawn to the mission of what our organization represents and continues to represent. Simply put, providing high quality, compassionate, and accessible health care for all persons in Santa Clara County, regardless of their socioeconomic status and ability to pay. I love seeing patients and taking care of the community. It's what I do. And I don't need to be the first one to tell you that we do great things in this county and at our hospitals for our patients and community. Without action, many of our essential services are at risk and may be completely eliminated, jeopardizing the health and well-being of the community. I implore you to the best of your ability, please do not let this happen and allow myself and my colleagues to focus on what we love to do and what we do best, taking care of patients.
Good afternoon, Jeremy Bruce with Amigos de Guadalupe, Center for Justice and Empowerment. Over the years, the county leaders have put their values to action by making strategic investments in our public hospitals to ensure our most vulnerable residents can have access to quality health care so they can live, work, and raise their families. As you all know, these are extraordinary times. At Amigos de Guadalupe, we've seen our immigrant families in dire situations. Though we're not seeing ICE on our streets like other cities across the country, arrests are still taking place. We're also seeing an overwhelming increase of families coming in our office seeking rental assistance. On top of that, thousands of immigrant community members in our community have been frozen out of Medi-Cal because of their immigration status. We have one mother who finally decided to seek medical help after suffering from violent headaches that just wouldn't go away. During her checkup, she was told her blood pressure is through the roof. The mother confided in us that these headaches and high blood pressure were a direct result of the immense stress she was feeling from the lingering fear of being separated and the uncertainty of not being able to pay the rent.
If I could have Ibrahim Diallo, Gabriela Hernandez, and Eva Terrazas please approach the podium. Thank you.
Hello, my name is Mary Gloner. I'm a resident of District 4. I'm speaking as a nonprofit management executive, a community health educator, currently engaging in youth well-being and empowering AAPI Native Hawaiian women. But most importantly, also as a member of a family who utilized the county hospital system many times. I want to underscore the strength, achievement, and value when government entities, state, county, city, collaborate with their operations, financial, and policy actions when confronting HR 1. We've collectively proven our leadership when we responded to the COVID pandemic, and I believe it is possible, again, to address that when addressing the harmful federal effects to Medi-Cal, CalFresh, and healthcare for the uninsured cuts. For the county to fill these gaps alone will take away valuable resources that will undermine effective community initiatives, many led by our nonprofit organizations. For example, school-based mental health counseling service, youth development activities, and strengthening protective factors.
Hello, my name is Roberto Gonzalez, community organizer with Fuerza Colectiva, and I am speaking in strong support of our county's budget request to the state. Our county's public hospitals are the safety net for everyone in this community. And as a reminder, our budget is not only a reflection of our priorities, but also our values. Our county and its residents have shown where our values stand, and we ask that the state follow suit. Thank you.
Good afternoon. My name is Ibrahim Diallo, advocating for Fuerza Colectiva, I'm a member. My tribe, the Fulani people from West Africa, they have a proverb. They say, "Chelal ko afongalu." It means that health is the firstborn of wealth. If we consider wealth as a family, it is the firstborn, meaning we have to protect that because it's the #1 priority. It's not a favor, it is a right. What I mean also is if the federal level, they are unpredictable for funds, I suggest, if it's not already done, I suggest that we have other plans, Plan A, Plan B, Plan C. So in case they deprive us from their funds, at least we are not in distress, we have other ways. So if you go to Sacramento, don't let them convince you it is impossible. The French people say, impossible n'est pas français. It's not, impossible does not exist. So it's the time for you to show us that,
Your time is up, thank you.
Thank you so much.
I've read all the names in chambers. There were 6 speakers that requested to speak before the queue was closed in Zoom.
Gabriel Hernandez, I refuse to organize in fear, and I think what I want to do is ask the state to act your size. This is a structural issue, and what you should do is go back, have them tax me for my state and federal taxes. You hold the federal taxes in abeyance. If the federal government wants my money, have Bonta defend that, and you guys figure it out. Spend that federal money however you want, and whatever's left, give it to the federal government. Oh, well, we fight it within the confines of law and all this. This government is not afraid of breaking the law. So have them sue the state of California one time instead of us suing them all the time. Use our money, pay for what we need to in this state. I've seen it in the 1980s when they did the free trade agreements. They wiped away and blurred nation states rights and protections for economics and money and all that, act your size. Act your
And we have 6 speakers on Zoom. First up, we have parent. You'll have 1 minute to speak. Timer will start when you begin speaking.
Yes, hello, good evening to you all. One of the places that we haven't received cuts from the federal government is Title 4B, and that pertains for child protection services. For some reason, I can't get that service for my children. They're being sexually molested. My son, he's confirmed that my ex-wife was letting a man rape him beginning at the age of 13. There'd been unnecessary bathing with the children. There was sexual contact between 2 of the children. And all this led to personality changes in my kids. They all became withdrawn and anxious all the time, and they stopped having friends. And I can't get a screening for my kids. Everybody in this room knows that I should have a screening. There's never been a screening. There's never been an investigation of any kind. I've complained to the CANC hotline. I've complained to the Board of Supervisors. I've complained to Wendy Camille-Rausch, and nobody will help me. Can somebody please help me get a screening? Use these Title 4B funds to get a screening for my children. Please, my name is Ben Z, and Supervisor Otterly, he's got all my contact information. Thank you for your time.
Next speaker is Jonathan Liebman. Go right ahead. Jonathan, your microphone is open. It's like we're having a problem with Jonathan. We'll go to Elizabeth Molina.
Hi, good afternoon. My name is Elizabeth Molina. I'm a community organizer with Planned Parenthood Marmonte, speaking in strong support of the county's budget request to the state. I want to thank the state elected officials and for the comments earlier for the investment into reproductive health across the state, but I truly hope to see the same investment and commitment into our own county here in Santa Clara County. Our community partners and county programs, as you heard, right, have been stretched thin beyond their limits. We've made deep, painful cuts to these internal systems, but we've also been innovative. But time is now for the state to step in and fulfill its role in protecting the health of our community. We're seeing a domino effect take place where our public system will soon overflood, which is the safety net for thousands of our residents living paycheck to paycheck, uninsured or undocumented community. So please act as a true partner, fully funds the budget request by the county, so our public hospitals remain open.
Next speaker is Jonathan Liebman. We'll give you another shot. Your microphone is now open.
Yes, can you hear me? Thank you. My name is Jonathan Liebman. I am a political organizer for SEIU UHW. I want to thank all the solutions that have been proposed. I definitely agree with what's been discussed. We actually represent about 120,000 healthcare workers across the state, and the last thing we want is to see any of them laid off or over 3 million Californians lose their care. There is a budget solution that has not been discussed here, and that is a tax on billionaires. There's a 5% tax on our state's 200 billionaires that is currently being, signatures are being collected. I urge the community to sign that petition, to become a petition gatherer. If you are able to, you can go to billionairetaxnow.org to learn more, but this would raise about $100 billion. It would be enough to actually undo the effects of HR 1, 2 different accounts. One of the accounts, 90% of it would go to Medi-Cal funding. The other account, 10% for K through 14 and SNAP benefit funding. This is a solution. The billionaires have taken more than enough. It's time for them to pay their fair share. So
Next speaker is Melissa Luke. You'll have 1 minute to speak.
Good afternoon. My name is Melissa Luke. I'm Chief Program Officer Healing and Justice at YWCA Golden Gate Silicon Valley, and I'm also representing the Domestic Violence Advocacy Consortium, or DVAC. Thank you to our Board of Supervisors, county staff, and our state delegation for your continued support of life-saving services for survivors of gender-based violence. We appreciate your leadership for your letter supporting a state backfill for the devastating federal cuts to the Victims of Crime Act. Violence is a public health issue and a social determinant of health, and these VOCA dollars are critical. Every year, our nonprofit agencies use these funds to serve over 2,500 adult and child survivors of sexual abuse and exploitation and provide over 1,800 in-person responses. In a world where we are sadly constantly reminded that sexual abuse is still all too common and still all too hidden, we thank you for showing up for these individuals and families. Thank you.
Next speaker is Odakonda Blee. You'll have 1 minute to speak.
Yeah, my name is Otokonda Blair. I'm calling from San Jose, California, District 5. Yeah, I'm calling to urge the state to leave Medicare open because as a mother and as a worker, I work in the childcare and I don't have insurance. So we rely on Medicare to get our insurance covered for me and my family. And my husband is retired. So carrying fund on Medicare, which means we are vulnerable as a family and as a community. And I know that there is so many people that are in the private sector that don't get insurance from anybody. So the Medicare is the only option for them and the children. So carrying Medicare is carrying the funds to a lot of people in our community. Thank you.
Our final speaker is Sharon Denoa.
Hi, I'm Sharon Denoa, the director of the South Bay Coalition to End Human Trafficking. In just a few months, we're going to see thousands of visitors to our county and region coming here for the World Cup. We've seen minimal investment from businesses and organizations most likely to benefit from these games, including FIFA. And as our community and businesses look to benefit, we need to ensure there's safety for our residents and visitors alike. We have to prioritize community safety resources and response, especially for sensitive crimes, including domestic violence, sexual assault, and human trafficking. This past Super Bowl affirmed the need for in-person response and coordination across our region, with law enforcement identifying over 70 survivors of trafficking who are adults, 10 survivors who are children of sexual exploitation survivors, and we need to have confidential advocates in these situations and coordination. Thank you to our county and state for your leadership in prioritizing safety and health.
And that concludes our public comment period from the time until it was closed.
Thank you, everyone, for being here with us today. I want to give a special appreciation to Assemblymember Patrick Aarons, Senator Cortese. You both had told me that you were only available till 4 o'clock. It is now 5:35. To our staff in the back room and on the dais here today, you told me you were only available to 4:30. Thank you for staying. Most importantly, to our community members here with us today, I know that time here is time away from your work. Thank you for advocating. There's a lot for us to think about, a lot of suggestions and recommendations for us to mull over today. Know that we don't hold these special hearings without being ready to do the work to follow up with it. Thank you so much. And with that, I adjourn this meeting to the next FGOC meeting on Thursday, April 17th, 2026 at 3 p.m. in these very same board chambers. Thank you.